Hello, 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 hello.
Hello. Hello. Yeah, can you hear me?
Hello, hello,
Hello. Hello.
hello,
Hello.
hello, hello,
Hello.
hello,
Sir, you're audible.
Yeah, I'm audible, no?
hello, 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 hello.
Hello.
Okay.
Hello.
ಒಂದು ಅಲ್ಲಿ ಹೋಗ್ಬೇಕು ಮೈಕು.
Hello.
ಬರ್ತಾ ಇದೆ. ಈಗ ನಾವು ಅವ್ರ ಹತ್ರ
Hello. Dr. Samir, sir. Can you hear me?
Yeah, I can hear you. Good afternoon.
Yes, we are starting in 2 minutes, sir.
Yeah, sure, no problem.
Yeah. Thank you.
Sciences for Societal Transformation. My request, Dr. P. Sandhya Ma'am, Regional Director, Center for PG Studies, VTU Regional Center, Mysuru, and Dr. Deepa Ma'am, Professor and Head, Department of Pharmaceutics, East West College of Pharmacy, Bangalore, to chair the session. Let's continue our today's session with a talk on translating innovations in antimicrobial stewardship, enhancing cancer care and societal transformation by Dr. Samir Dhingra Sir, Associate Professor and Head, Department of Pharmacy Practice, Naipur, Hajipur, Bihar. Sir will be joining us online. Dr. P. Sandhya Ma'am is an Associate Professor in Department of Computer Science and Engineering, VTU, Mysuru. Ma'am was awarded with the Travel Fellowship Award from the Alzheimer's Association. She has presented a paper at AAIC, Toronto, Canada. It's an honor to have you with us, ma'am. Welcome, ma'am. Dr. Manasa Deepa R. Ma'am is a professor and HOD, Department of Pharmaceutics in East West College of Pharmacy, Bangalore. She has published over 24 research and review articles. Ma'am has presented over 11 posters at various national and international conferences. It's a pleasure to have you with us, ma'am. Welcome, ma'am. May I now request our chairpersons to introduce our speaker to the gathering.
Hello. Yeah. I feel it's my immense pleasure to introduce Dr. Samir Dhingra, Associate Professor and Head, Department of Pharmacy Practice, and he is also a coordinator for Pharmacovigilance and Metrovigilance, Indian Pharmacopoeia Commission, Naipur, Bihar, India. His area of interest includes medication safety and promotion, rational use of medicines among healthcare professionals. He's having more than 20 years of teaching and research experience, and he is a leading expert in the field of pharmacovigilance. And he's having a huge contribution towards the research by publishing more than 100 research papers in peer-reviewed journals. And he is also filed Indian patents. And he is recognized as the world's top 2% scientist. He tops among the scientists. It's wonderful to know about Dhingra. And at the same time, he has also received several awards and achievements. He has received the appreciation and awards from various organizations, and he is a member of various health international and national bodies working in the field of health and life sciences. So with this brief profile, let's welcome Samir Dhingra. Sir, over to you.
Thank you so much, Chairperson Madam. My voice is audible to all of you? Is it audible? Yeah, can you hear me?
You're audible, sir. You can talk.
Yeah. Thank you so much. So first of all, I'm very much grateful. I'm very much grateful to Dr. Hanmantachar Joshi for giving me an opportunity to be as an invited speaker for this international conference on translation of value education and innovations in health sciences for societal transformation. When I looked at this topic, for the conference theme, that itself it is very, very, I should say, innovative. And when I thought of the sharing the topic, I was just realizing, being a pharmacy practitioner or being a pharmacist or being a pharmacy student or pharmacy graduate, anything which you want to translate into value education that cannot be fulfilled. Education as well as innovation, that cannot be fulfilled in health sciences until unless our pharmacy students say develop specialized skills, they have inherent knowledge of the subject. And when I thought that thing, then I was realizing what topic could be the best in post-COVID scenario. Okay, so when I thought on this, then I thought, let me speak on antimicrobial resistance, because in post-COVID era, when the society is looking at for the things, I think this is one particular domain where the pharmacists, they need to have some sort of knowledge, as well as they need to develop skills, so that if tomorrow any other pandemic come like this, our manpower, our manforce, human resources should be well in place to meet those challenges. And my dear students, this COVID, it as a pandemic, it came almost after 100 years, almost after a century. last pandemic before COVID, it came, I think, around the same period, 1916 or 17. But next pandemic after COVID, that may not take long time. And as a pharmacist, as a frontline worker, as a healthcare professional, we need to develop few skills. And I think when I
Sir,
speak about
slide.
this topic, so I am going to speak on translating innovations in antimicrobial stewardship, enhancing cancer care and societal transformation. So dear student, if you'll see this, today we are going to discuss, I'm going to discuss a pressing global health issue that threatens the lives of millions of people around the world. And if you see the recent global news or the headlines in the last almost 3 or 4 months, when I was preparing this slide, I just tried to give a Google search and try to find out what are the key headlines in the recent past. And these are the few headlines which I could collect from the very authentic source like WHO website, CDC website. And it indicates like WHO report shows alarming rise in multi-drug resistant bacteria across the globe. This is just 3 months back, the WHO appeared on WHO website. Then the very next news, expert call for increased investment in new antibiotic development to combat AMR crisis. Then the next headline, healthcare systems urged to implement stricter antimicrobial stewardship guidelines. Then last but not least, climate change may further exacerbate antimicrobial resistance concerns. So my dear students, you can well imagine how much this pressing issue is and how much it has a growing concern that even it has been declared as a global public health emergency. And all of us, we need to work together. And when we speak about transformation cannot happen until unless we share our knowledge, until unless all healthcare professionals they put their coordinated efforts and drive the meaningful action. And I think antimicrobial stewardship is one domain where all of us we need to work together to ensure a healthier future for generations to come. And I think that was the moment, if you see the in the last year, September 2024, in the 79th United Nations General Assembly, in a high-level meeting on antimicrobial resistance, where all the stakeholders, all the key leaders from various countries, they met together and they commit to decisive action on antimicrobial resistance. And you can well imagine it is not only among the healthcare professionals, even the global leaders, they are coming together to deal with this problem in United Nations. And very recently, just 2 months back, many of our pharmacy colleges, medical schools, dental schools, nursing people, all of us, we celebrated, AMR Awareness Week between November 18 to 24. And the theme was to educate, advocate, and act now. And if you see these three, messages, one is the educate, advocate, or act now. I think it is meant for our today's, the conference theme, translation of value, education, and innovation for societal transformation. Until unless we educate the people, until unless we put the advocacy or do not act, societal transformation cannot happen in the healthcare setting and we cannot save the lives. And look at the statistics. If you see the global public health emergency, more than 1 million people died from AMR globally each year between 1990 and 2021. And this data is coming from very recent study that was published in Lancet 2024. And it indicates almost every year more than 10 lakh people have died between 1990 to 2021 because of AMR. And over the period, AMR deaths among children aged under 5 declined by 50%, while those among people aged 70 and older increased by more than 80%. So there is a huge concern. And if you see, as per this paper, Lancet paper, the projected impact by 2050, AMR deaths will rise steadily in the coming decades, increasing by almost 70% by 2050 compared to 2022 and continuing to more greatly impact older people. And if I am not wrong, the people who are sitting there for the conference, including me at the age of 46 or 47, all of us after almost maybe after by 2050, will be entering into almost middle to advanced age. And that time the ratio, this percentage will be going steadily high. So that is again a concern in the coming years if we are not putting a hold on this AMR. definitely it may take lives of many of us. And when I look at the cancer patients, since I'm working at Naipar Hajipur, and one of the clinical facility where we have a good collaboration, it's a tertiary cancer care hospital. And our students, postgraduate students from Naipar Hajipur, they're working on cancer patients. And among cancer patients, I thought many of our students from biotechnology department, other department, even from pharmacy practice, they're working on the cancer and cancer treatment, efficacy, safety, all those things. I thought, let me work on AMR. Let me assess the, the infection rates, and let me see the epidemiology and other things among the cancer patient. And if you see the cancer patient, all of us, we know as a pharmacy graduate that cancer itself, it is a immunocompromised state. And when any cancer patient, he or she develop an infection, that always comes as a double burden. And that infection, it increased the susceptibility. Basically, in case of cancer patient, there is increased susceptibility to infections, because all of us, we know, because of their weakened immune defenses. And they more oftenly they go for surgery and treatments like bone marrow transplants, radiotherapy, chemotherapy, all those things, they compromise their immune system, and they have their own consequences. And 1 in 5 cancer patients is usually hospitalized due to infection. And there is a 3 times greater risk of fatal infection compared to non-cancer patients. And these patients, they are more prone to develop pneumonia as well as sepsis, and these are the leading causes of ICU admission. And if you see the impact on the cancer mortality for the infection itself, 8.5% of cancer deaths attributed to severe sepsis. And this data is coming from developed countries, from upper middle income countries. I don't know whether the statistics are available for, the lower middle income countries or not, but I'm sure otherwise this data may be much higher in our country like India, where the resources are limited. And in cancer hospitals, many patients, they die because of infection. And it is not only infection, I will say it is a triple burden. If an infection patient, if the medical fraternity or healthcare professionals, if they're not able to prevent the infection, ultimately it enters into antimicrobial resistance. And this antimicrobial resistance more often threatens cancer management. And infection in cancer patients are becoming extensively resistant to antimicrobials, and threatening recent advancements in cancer management, and requiring healthcare professionals to postpone or withhold intended cancer treatment. And it has its own alarming consequences of antimicrobial resistance, because of their immunocompromised status. And antimicrobial resistance infection causes more than half of all deaths in cancer patients, and a 30 to 70% drop in antibiotic efficacy could lead to approximately 4,000 to 10,000 more infections and 500 to 1,000 more fatalities annually in the US. So this data is US, and already I mentioned in country like India, it may be much bigger. And there is a need for effective prophylactic measures, understanding the evolving epidemiology of bacterial and fungal infections, their sensitivity patterns in cancer patients. And I think these things can play a crucial role for developing effective prophylactic measures. And this is one of the study which, we have carried out. It was basically carried out by our NIPER students on risk factor and impact of AMR on clinical outcomes in cancer patients. And this is just a study methodology which we carried out at Mahavir Cancer Sansthan and Research Center. As already I mentioned, it's a tertiary care hospital, charitable hospital. And study design was basically a prospective, and it was a 9-month study conducted among 440 patients with positive microbial culture and antimicrobial sensitivity. And as per the requirement, ethical clearance was obtained for this particular study from the ethics committee. And when we compare the baseline of characteristic between the 30 days survival and 30 days mortality subgroup, we found that the majority of the patients, they had solid tumor in our study, and while the rest had the hematological cancer. And most of the patients among the the solid tumor patients, most of the patient had head and neck cancer, followed by the cervical cancer, then acute leukemia, breast cancer, and gallbladder cancer. But see, the mortality rate was higher in patients with acute leukemia, followed by the gallbladder with the 12.58% and head and neck of approximately 12.14% and cervical with 11.42%. And when we compare the microbiological characteristics between the same survival and 30 days mortalities group, we could find out that when we compare the difference between the frequency of gram positive and gram negative bacteria in 30 days survival group to those with the 30 days mortality group, gram negative bacteria contributed more to mortality. In approximately 80% of the patients, gram negative bacteria, they were responsible. And the 30 days mortality was greater in cancer patients infected with most of the microorganism. Among the gram negative, we could see Klebsiella pneumoniae, then E. coli, then K. oxotica, P. aeruginosa. These were the major organisms which were behind in those infections. And among the gram positive, what we could see Enterococcus species, then cons, that is the Coagulus negative Staphylococcus species, along with MRSA. These were the species which were behind the mortalities among the patients. And when we saw the source of infection among the patients in both the groups, so 30 days survival versus 30 days mortality, maximum patients, the source of infection was the pus. In most of the cases, the pus, then followed by urine, then blood, sputum, tracheal aspirate, then remaining few other, source of infection. And majority of the patients, they had monomicrobial infection. And type of infection was the nosocomial. More than 75% patients, they had nosocomial infection. And gram-negative bacteria, already, as I said, approximately 77% of the patients, they had gram-negative infections, bacteria infections. And the antimicrobial susceptibility, when we looked at, it was mostly with the multi-drug resistance, followed by the XDR, then the sensitive organisms. And this is the gram-negative spectrum. And since two different students have worked, one was working on the adult population, other student was working on the pediatric population. And when we compared both among the adult versus the pediatric population for gram-negative bacteria, K. pneumoniae was responsible in both, but values were different. In case of adult, it was 25%, whereas in case of pediatric population, it was seen among 31% of the population. And whereas in case of adult, E. coli was on number 2, but here in case of pediatric, on number 2 was Klebsiella oxotica with 27%. In case of adult, it was on number 3. Then remaining organism like in adults, Pseudomonas aeruginosa, then other Klebsiella species, then Acinetobacter baumannii. These were the organisms involved. Whereas in case of gram-negative also, the organisms were same, but their values were different. Similarly, for gram-positive, in case of gram-positive, most of the infections were caused by methicillin-resistant Staphylococcus aureus, followed by Enterococcus species, then cons. Whereas in case of pediatric, here also MRSA, but second organism here was Enterococcus, but the values were highly different. Comparatively, it was less in pediatric, then cons, then MSSA. Then we looked at the distribution of pathogens as per the source of infection. Klebsiella pneumonia, maximum it was seen in pus, urine, blood, sputum. Then followed by Klebsiella. Klebsiella was maximally seen in the source of infection was basically urine. And when it comes to the Klebsiella species, it was almost same in pus and urine. But E. coli was more in urine compared to pus. And P. aeruginosa, very much it was seen in pus only. So for other organism also in similar pattern, we have given the distribution. We have prepared this, table for the distribution of pathogens on the basis of source of infection. And on the basis of our study, we have developed this antibiogram for Mahavir Cancer Hospital for the, for the clinicians, and we have shared with them. And nowadays they are using this information also. But for your understanding, for the students' understanding, if you'll see we have given this tabular data, this antibiogram, where you see the green color, there the microorganism have shown very good susceptibility. For example, if you see the very first row, the organisms, they have shown very good efficacy against tigecycline, vancomycin, particularly against the glycopeptides. But for polymyxin, oxazolidines, carbapenems, aminoglycosides, phalosporin, beta-lactam, most of the organisms, they have developed the resistance. And from our study, among cancer population, the only thing we could say among the gram-negative, they are only responding to tigecycline, vancomycin, and linezolid. Remaining all antibiotics, now it is not working. And most of the organisms, they have already developed the resistance against, most of the classes of antimicrobials or antibiotics. Similarly, for gram positive, we have collected the information, and even in case of gram positive, also only very few antibiotics we could see where the microorganisms have shown the efficacy. Otherwise, most of the organisms, they have developed the resistance, or they have basically developed the resistance only against most of the antibiotics. So this is for similarly, the other student, she has prepared the antibiogram for pediatric population, which has been, we have given to their pediatric ward as well as their antimicrobial committee, and they are utilizing. And similar pattern we have seen among the pediatric population also. Most of the organisms, they have already developed the resistance. Only very few antibiotics like tigecycline, vancomycin, these kind of antibiotics are remaining, which are still responding to the treatment. Otherwise, most of the antibiotics, they have developed the resistance. And this is another slide where we have looked for the risk factors for AMR in cancer patients. And according to our study, patients with a history of surgery have a 2.73%, or sorry, 2.73 times higher risk of developing AMR compared to those without surgery. And this risk was statistically significant in our study. Then second factor was the history of chemotherapy. And here we could found that chemotherapy exposure significantly increases the risk of AMR by almost 5 times. And this association is highly significant. And the third factor for AMR, which we could see in our study, was the history of antibiotic use. And here the prior antibiotic use, basically it is known as a strong risk factor for AMR with a 2.46 times higher risk compared to those without antibiotic exposure. And then the history of hospitalization. Here, if you see the odds ratio, it is 2.93. So that indicates that hospitalization is associated with a 2.93 times higher risk of AMR with a p-value of 0.034, suggesting moderate, statistical significance in this particular group of patients. Then type of bacteria, gram-negative bacteria are associated with a significantly higher risk of developing AMR with odds ratio of almost 23.44 times and a p-value of 0.001. Then comes the neutropenia. Neutropenia, students, as you know, it is basically a low white blood count, and it increases the risk of AMR by 1.24 times with a p-value of 0.009, indicating a significant association. So student, if you'll see this table, I think this table itself indicates many times, all the healthcare professionals, they have to be more careful when we are dealing with the cancer patient. And not only in the clinical facility, if you see the history of antibiotic use, if you see our Indian scenario, and I think in most of the states, you go to any pharmacy, pharmacists without prescription, they are ready to, I will not use the word dispense, I will say they are ready to sell their medicine. During COVID-19 time period, you have seen how the drug like azithromycin, that is azithromycin, and other antibiotics, they have been given without prescription. So these are the things after seeing this scenario, when the patient enter into the hospital, all these things, not only from clinician side, I will say, for example, history of surgery, those things are still beyond patient control. But at least history of antibiotic use, that does not start from the hospital, that starts from the community itself. Remaining things I can still feel that those are nosocomial in nature. But there are many things that patient may bring from the community also. So I think we have to be very careful as a healthcare the setting when it comes to medical procedures, when it comes to the treatments, when it comes to the underlying conditions, because all these things contribute to the development of antimicrobial resistance in the patient. And these type of findings basically highlight the importance of prudent antibiotic use and infection control measures to minimize the risk of AMR in cancer
Sir, you have 10
patient.
Sir, you have 10
Yes,
minutes.
sure, sir, no problem, sir.
Okay.
And if you see the risk factor for 30 days mortality, patient experience a recurrence of their disease have a significant higher risk of 30-day mortality. Almost you can see 27.65 times higher. And then comes the sepsis. Sepsis is the another risk factor for 30 days mortality. And the patient who develop sepsis, that is already, that is a life-threatening condition where, that is caused by the body's response to infection. And it is associated with 6.7 times higher risk of 30 days mortality. And then third thing is the chemotherapy. Chemotherapy itself, it is associated as a risk for 30 days mortality. And it is, if you see the odds ratio, it is 3.54 times higher risk of mortality. And this association is statistically significant. Then comes the use of Foley catheters, Ryle's tubes, and central venous catheter. So these are the, I should say the devices which we use. But definitely these devices themselves, they can be a cause for mortality also. And at least you see the odds ratio for Foley catheter, it's a 4.3 times, Ryle's tube 2.7 times more risk. In case of central venous catheter, the risk is it's almost 12.51 times higher. Similarly, Masco, pneumonia, ventilator associated pneumonia, then XDR, MDR, these are the risk factors associated with 30 days mortality. And if you see the length of stay for the hospital stay across the antibiotic susceptibility class, I think this figure, the box plot, it is showing the distribution of length of stays, and basically it was measured in days for patient based on the class of antimicrobial resistance. You can see for the sensitive, MDR, and XDR. And for XDR cases, the length of hospital stays were comparatively lengther or longer compared to other two groups, that is the MDR and sensitive group. And if you see the clinical outcomes in pediatric patient, in case of pediatric population, outcomes were bit comparatively, I will say, better. 60% patients, they were discharged. Almost 16.6% patients, they discharged against medical device. Then death rate was almost 20% in our case group. And remaining 2.6% patients, they were further referred group. And length of hospital stay greater than 2 weeks for 44%, 3 to 4 weeks in 44%, and greater than 4 weeks among 12% of our pediatric population. And this is a Kaplan-Meier survival curve based on antimicrobial susceptibility class. And it basically illustrates the 30-day survival on the basis of antimicrobial or antibiotic susceptibility class, where the x-axis represents the number of days, whereas the y-axis represents the cumulative their survival. And patients with higher levels, in this case, the patients with a higher level of antimicrobial resistance, basically, they have lower survival rate compared to the other classes of groups of patients. And when it comes to the recommended activities, I think where the pharmacists, they can also play active role in promoting the antimicrobial, prescribing when they're working in the hospital setting, particularly the students who are more oriented towards the clinical facilities or hospital-based trainings. I think these are the things where they can become a part of those teams. They can implement the daily review that promotes appropriate antibiotic prescribing, including drug selection, dose, route, frequency, and duration. Then they can also develop tools that can help to prescribe appropriate antibiotic therapy, including guidelines, order sets, alerts, and educational material. Then students and the other pharmacists who are working pharmacists, they can help to establish and monitor stewardship related metrics, including measuring antibiotic use, cancer-specific antibiogram, as our students have done. Even other group of students, first-year students, they are helping in other clinical facility when they're going for rotations, and tracking C. difficile and multi-drug resistant organisms. Then develop a structure and culture that promotes appropriate antimicrobial prescribing, including established multidisciplinary team of key stakeholders interested in antimicrobial stewardship. Then use microbiology and lab results to improve antimicrobial prescribing. rapid bacterial diagnostic tests can quickly identify an organism and resistance mechanisms. And galactomannan and 1,3-beta-diglucone can aid in diagnosis of fungal infections. Then provide periodic feedback to key stakeholders, share predefined metrics, identify areas for improvement, and share successes and challenges. And students, nowadays, rapid diagnostic tools are also available for detection of AMR, multiplex PCR, that can be very, very helpful for advanced molecular testing, that can quickly identify the presence of specific antibiotic resistant genes. Then now whole genomic sequence you can perform and comprehensive genetic analysis to detect a wide range of resistance mechanisms and predict susceptibility profiles. Then automated systems are available. Those provides the innovative platforms that can rapidly determine antimicrobial resistance patterns from clinical samples. And then last but not least, that is the point of care testing that can be done for the mass screening. And these are basically portable devices that enable fast on-site detection of resistant pathogens and guiding targeted therapy. Then this is the road ahead. And being a pharmacist, being a pharmacy professional, definitely we have to be a part of multidisciplinary collaboration for fostering partnership between oncologists, infectious disease experts. I'm talking about cancer hospital, but for remaining hospital, if you're working, other experts may join you, and the other infectious disease experts, microbiologists, and policymakers to address AMR. Then targeted funding and incentives. There is need for increasing investment in research, development, and implementation of AMR prevention and control strategies. Then we need to establish robust policies and guidelines to ensure the judicious use of antibiotics and promote rapid diagnostic adoption. It is not only the treatment. I think nowadays regulatory bodies are also more concerned. More and more point of care tests, biotechnological techniques are coming into picture, and I think those things will help us to sustain at early stage any type of infection it is there, that will help us to identify the gene patterns and all those things. And last but not least, we need to have the global coordination by collaborating internationally to share best practices with the other stakeholders, harmonize our surveillance, and develop comprehensive solutions to AMR. I think that's all. And I'm grateful to my students and my other colleagues, Dr. Palvi Priya, Dr. Akshay Shelke, and students. Boys, this work is being carried out by Vishala, Bhavna, and Vabhi. Now they are already in the industry, working for the industry. Thank you.
Thank you,
Thank you.
Dr. Sameer. And for the interest of time, the session house is open for the 2 to 3 quick questions from the audience.
My dear young research scientist, this is Professor Dr. Gyan Chandran. A very excellent presentation about this antimicrobial research, antimicrobial stewardship, which is an alarming situation for the generation coming. I have been associated with some of the scientists where we have also discovered new drug molecules, as you are mentioning in your slides, about N-methyl tazobactam in combination with cefepime to overcome the chronic urinary tract infection and hospital-acquired pneumonia infections. This drug has been approved by US FDA as well as UK medical agencies, and it is outsourced by Chinese company. Because this antibiotic resistance, because in a country like India, where there is liberal use of antibiotics, haphazard use of antibiotics, irrational use of antibiotics, there is illiterate use of antibiotics. This antibiotic is liberal use, so it is a concern for Indian population. We as pharmacy students and pharmacists, healthcare providers, as you rightly said in your speech, your slides, this conference theme is the benefits of this conference to go to the ultimate customer, society, community. So we are here, and what I do, one thing is antibiotic god. Antibiotic god, somebody has to be there in a hospital setup. When you are prescribing an antibiotic to a particular patient, a person has to be got it. for the patient is taking the antibiotic every 12 hours, every 8 hours, how many days they are giving, either 3 days or 4 days or 5 days. This has to be implemented. Otherwise, I have no question about your slides. I have all the appreciation. I want your association with you. Thank you very much. Thank you, my dear students.
Samir sir, thank you so much for your wonderful presentation. In fact, I have one question, if time permits, the organizers. Yeah. One of the reason for ARM is either the overdose or the misdose of antibiotics. Normally, for respiratory diseases like COPD, the doctors, they prefer or they prescribe antibiotics. Is there any guidelines, like we observe the gold guidelines for COPD? Is there any mention of with what dosage the antibiotics need to be prescribed? Because many a times the patient who is suffering from the cancer may also be suffering from COPD or any respiratory problems. Just out of interest, I am asking you, is there any guidelines for prescribing the antibiotics in the gold guidelines for COPD?
No, thank you for your question. And when it comes to the gold guidelines for COPD, definitely it clears about the treatment for COPD patient, chronic obstruction of pulmonary airways patients. But when it comes to the uses of antibiotics, I think antibiotics already the guidelines are as per the body weight we have to give. And when it comes to the duration has to be decided by the doctor and complete course must be given. And if in between, if initially doctor has given for 5 to 7 days, if they're asking for a follow-up to the patient must do the follow-up to make sure that the infection has been fully cured. And I think clinician on the basis of, during the visit, they can see if the infection is totally cured, they will stop the antibiotic. If they still continue, want to maybe for another week, then definitely they may prescribe to the patient again. But yes, guidelines are there for the usage of antibiotics, and more oftenly, it is given as per the body weight.
Yeah, thank you. There is one more add-up point here. But we all talk about the drug-induced antimicrobial resistance or the hospital-induced antibiotic resistance. And I feel that we have to add up more about the day-to-day life, what we come across with various sources of the antimicrobial resistance, like the milk, consuming the milk, what we are consuming, the rice, and so many the sources that also has to be addressed in the future days of the antimicrobial resistance. Anyway, in the interest of time, I don't want to kill your valuable time. Thank you so much for joining with us. On behalf of APSE, a big round of applause for your valuable time with us. Our next speaker is already in the lobby. I don't want to waste his valuable time. Let us move quickly to the next speaker, Dr. Palniswamy Sivanandi. He is a senior lecturer, pharmacy practice, School of Pharmacy, Kuala Lumpur, Malaysia. His area of the research interest in cardiovascular and diabetic medications, oncology, pharmacovigilance, drug safety monitoring prescriptions, auditing clinical research and development, cerebrovascular complications, as well as clinical trials, patient safety, social and administrative, pharmacy and false risk medications. Over 19 years of teaching and research in pharmacy, he have more than 100 research and review papers, and he has awarded with various his academic achievements. I want to highlight few of his achievements to the audience: Outstanding Research in Pharmacology, Education Leadership Award, Global Knowledge Management Award, Dynamic Pharma Teacher Award, Fellow of the Royal Society for Public Health. So without wasting his valuable time, I request Dr. Palniswamy sir to give his lecture. Over to you, sir.
Okay, thank you, ma'am. Can you hear me?
Perfect, sir. Go ahead.
So the slide is visible, right?
Visible. Go ahead, sir. But make it as a slide. Yeah, thank you.
Okay, thank you everyone. First of all, very good afternoon to everyone. Okay, hope you had your very good lunch. And I'm Dr. Palanisamy Sivanadi from the Department of Pharmacy Practice, IMU. And I'd like to thank the organizing committee members of APSE for providing such an opportunity to deliver a talk as well as interact with you. So, everyone, today we are using artificial intelligence. So, I'm going to talk about artificial intelligence, the use of artificial intelligence in higher education, and what are the challenges as well as opportunities. I'll quickly go through what are the things, because everyone using artificial intelligence nowadays. Without artificial intelligence, you cannot hear my voice from Malaysia. Everything artificial intelligence enabled. Whatever you do today, texting your friends now, currently you are texting with your friends, or maybe chatting with your friends, talking with your neighbors, your family members, and searching so many things in online purchase, everything, e-commerce, studies, okay, open and digital learning, everything AI. Without AI, we cannot move even a single step forward in our academic as well as research and all other day-to-day activities. So AI is there everywhere. I'm going to talk about what are the challenges, opportunities, and how we are using AI in our day-to-day life. What is AI? What is artificial intelligence? It is a big mass and artificial intelligence providing a platform for us to interact with the machines. Normally, a human can interact with another human, a human can interact with the animal, but how we can interact with the machine? The machine also can provide a useful tool for us, useful solution for us. So, the AI providing a platform to interact with the human as well as the machines, and whatever we input, they will interpret, and it will provide a valuable solution for us in our day-to-day life. Whatever the information we supply, that will be processed, and the AI will take appropriate action for our goal. For let us say, for example, you want to prepare an assignment. Whenever you input the data, what are the topic, how many words, and what are the context, it will prepare a very good tool for you. It will prepare a very good assignment for you, and you can submit on time. AI can adapt. Sometimes the human being will not adapt, will be adamant to adapt the new situation, but AI will adapt himself or herself, and it will based on the query, based on the term, whatever you input. We used to say tuning the AI, okay, through the keywords. Whenever you tune the AI with the appropriate keywords, it will synthesize a new information by internalizing the data what you give it. Thereby, it will provide the maximum effectiveness of the information. It means accuracy. The accuracy is purely based on whatever we input. Okay, and AI can also provide a platform for us to make a decision. Whatever the information provided by the AI, we can scrutinize, and if it is appropriate, we can do it for decision making. So AI is very, very useful tool, and also there are so many things are there we'll discuss in the future slides. What is the main aim of AI? What is the goal of AI? The main goal is increase outcome. Whenever you prepare any documents, okay, and you are asking people to do it, what happens? They will take a lot of time for you to submit the document. And if you're preparing something, for example, we are preparing a curriculum, it will take a lot of time. But the AI will give the outcome within 2 to 3 minutes. If you want to prepare assignment as a good student, you will take minimum 1 week to prepare a very good assignment. But AI will give within 2 minutes or maybe less than 1 minute. And also lower cost. You don't need to pay anything for the AI. Whatever you use conventional mode, you can get it free of cost. And also access. Wherever you are there, whenever you are there, okay, you can access the data from anywhere. If you want to refer a book for your academics, you need to purchase the book. Sometimes the book is not available online. Maybe it's a hard copy. or maybe the book is very expensive and you're not afford to buy. But no worries, AI, if the data is already uploaded in the AI, online or any electronic database, the AI will get access for you. It will prepare the document and it will prepare the content and it will give it to you. So accessibility is very, very high. Again, decrease time to completion. As I mentioned earlier, if you want to prepare a curriculum, it will take minimum few months, even few weeks before we are preparing. We train the AI and we prepared a curriculum. Within 10 minutes is given a very good curriculum, how many credit hours, what are the teaching methods, what are the teaching modality, and what topic should be suitable for a problem-based learning, what topic suitable for the lectures, everything prepared along with the references within 10 minutes. Everything. So AI is a very good tool, and also having retention. Whatever you prepare, the document will be stored in AI and it can be referred anytime. Again, what are the different types of artificial intelligence tools available and how we are using it? Most of the time we use AI for planning, maybe planning some activity or maybe planning to submit some documents, and also for robotics, machine learning, and also natural language processing. One of my close friend went to Japan. He know English as well as Indian languages, Hindi as well as Tamil. He don't know any other language. He landed in Japan. At the time when he realized that without knowing Japanese, you cannot survive in Japan. So immediately he downloaded an app. Now the app can recognize the Japanese language and convert into English. So he can easily understand. Natural language processing is the main important tool nowadays, in the AI era. Then you can assess the perception, knowledge, and cognitive system by using AI technology. So there are different types of AIs available for different purposes. So as I mentioned, AI is not a simple tool. There are so many documents are there, so many applications are there in the AI. You can use it for research, there are separate tool, and for the text messages, there are separate, and for the video creation, there are a lot of tools are available. And for the image as well as coding, for the IT people, there are a lot of coding apps are available. It is enabled with the AI, and also for the speech and 3D images. So there are so many different types of applications, AI application available in the day-to-day life. We can broadly classify the AI applications into two types, either type 1 or type 2. Type 1 will be coming under the narrative. So there are a lot of narrative AI applications available. We are using the day-to-day life. Even if you see, whenever we write something in the WhatsApp, immediately it will suggest the language. Whenever you type something in your Word document, it will suggest the language. It is AI enabled. It is recognizing the typing, whatever the word we are typing, and it will provide some suggestion. This is not grammatically appropriate, so you have to use this sentences, this context in your write-up. So it is AI enabled. So it's a narrative AI. Another one is generative AI. It will synthesize the document. For example, ChatGPT, Gemini, and the DeepSeek. There are so many things are there. Now the talk of the town is DeepSeek. So all these are generative AI. We have another one that is a super AI. It can do multiple tasks in a single minute or single second. Again, the type 2 is a reactive machines. The machine will recognize your word, the keyword. It will process the keyword and it will provide the responses. It will work either the theory of mind or maybe self-awareness. And also we have limited memory applications. They will do only certain functions. So there are different types of artificial intelligence tools are available. Again, in the normal higher education, we are using artificial intelligence tools. I don't know about how many are about these of artificial intelligence tools in academic, but we already started using it. Even the Western countries, European countries, okay, they are already started using so many artificial intelligence tools. Even if you see IIT Madras, IIT Delhi, IIM, already started using a lot of artificial intelligence tool, and they are preparing a lot of, delivering the small courses, CPD courses using artificial intelligence. And we are using VR, virtual reality, augmented reality tools, metaverse, internet is very common, is another AI enabled tool, blockchain technology, cloud computing, gamification. In the current era, the 2021, okay, if you don't know what is gamification, maybe you are outdated from the field. You should know what is gamification. Nowadays, the kids, the students are more fond of gamification. If you use the blackboard, whiteboard to teach the students, they never listen. It will be very boring. So you need to include some gamification or maybe some interactive application inside your lectures. Thereby, they will be interested and they will study a lot. Otherwise, they never listen to the conventional mode of lecturing. Another one, chatbots. There are so many applications are available. Where we are using the artificial intelligence, mostly we are using for e-commerce applications, online shopping, marketing, even we are using in agriculture, social media, domestic applications, gaming applications, healthcare applications. Lot of hospitals now they started using AI. Again, robotics, navigation. If you want to use, if previously if you want to go abroad, you have to take map and you have to mark everything. Now the Google Maps, it will guide you where to go, left, right, straight, everything it will guide you. So it is navigation application. We are using AI. It is like a mentor. The mentor will guide you how to go left, right, everywhere. Okay. Then finance application and all the day-to-day application we are using AI and also in education. So AI is everywhere. To the academic higher education, even now, if you see the Western countries already started using artificial intelligence tools, the tools in schooling. But now only we started using AI in higher education. AI is very, very important higher education. In future, without AI, we cannot survive. We cannot sustain in the field. If you are a student, you must learn something about AI, how to use AI in your academics. Apart from studying, along with studying your pharmacy degree, you must know how to use the AI appropriately. Okay. So AI is very, very important. What the study says, an average lecturer or a teacher spend about 50 hours of time in teaching the student. The data says 50 hours an average lecturer spend a time to teach a student. Out of this 50 hours, 10.5 hours for preparation of material, 6.5 hours for evaluation and providing feedback, and 3 hours for professional development or personal development, and 5 hours for administration, and 16.5 hours for student instruction or engagement, and 3.5 hours for student behavior or maybe emotional skill development. Then the last 4.5 hours for student coaching and advisement. If you see overall, only 49% of the entire time is spent with the student in a direct contact, but remaining 51% of the time are spent virtually, either through WhatsApp, either through telephone calls, or maybe other means. Okay, only 49% of the time we spend with the students directly. You can understand that how the AI is, or the media, online media is influencing in our day-to-day life in the teaching. How the students learn, or how the students using AI. Mostly they are using AI for creating ideas, searching information, or drafting some documents, or maybe assignments, or what are the information they want, analyzing the information, or analyzing the data, and getting feedback, as well as tidying up the things. As a normal teacher, we use AI for connecting with the students. If you see me, I'm a program director working at IMU. For the last almost 8 years, I have multiple groups. For every cohort, every semester, I will be having a group. Most of the time, even I don't know the students' face as well. But I always communicate with them through WhatsApp, through Teams, through email. So most of the time, we are using AI for connecting with the students. The current students, the prospective students, as well as the alumni. And also designing the contents. Then also teaching, providing feedback, and also supporting the students, supporting the administration, and all kinds of support, either to support the mentor or mentee or to support to the institutions, whatever it may be, we are using AI. So AI is an integral part of our life. There are different types of AIs available, as I mentioned. There are chatbots for teachers as well as trainers. We can use the Perplexity, ChatGPT, Gemini. There are so many things are there. Copilot. So we can use many different types of tools. Some are free and some are paid version. You have to pay. Okay, but most of the time, the preliminary version, standard version is free of cost. So we can use any of the tool in our day-to-day life to prepare notes and to educate our kids. This means students. Again, there are a lot of toys available. I'm not telling about the physical toys, it is online toys. Okay. Instead of a gaming app, we used to say it is a AI tool or AI toys. Okay. These tools are available to prepare gamification or interactive tool to interact with the students while teaching the students in the classroom. Okay, apart from the blackboard or whiteboard, we can use these type of tools to interact with the students. Thereby they will be stimulated to learn more and they will provide more attention. And in case of campus life, if you see, everywhere we are using campus. Okay, everywhere you have a campus, or maybe a small campus or big campus. In future, the campus will be completely enabled with the AI. Not only the surveillance camera, even now most of the countries, even our institution is started moving towards the AI. Now we are using AI everywhere. Okay, I'll tell you how we can use it. The study says that teachers under 26 are most eager to introduce AI to students. It means the young generation are most fond of AI. They are planning to use AI in the day-to-day life in terms of teaching as well. And the AI-powered educational games are used by 51% of the instructors. If you're not using any of the AI tool in your teaching, you're not coming under even the 50%. Again,
Sir, you have
adaptive
another
learning.
10 minutes left, sir, to wind up
Sure,
the.
sure. I will go quickly. Okay. We are using adaptive learning platform as well as automatic grading system. Okay. And in our day-to-day life for the teaching the students. There are so many different types of tools, analytical tool, functional tool, interactive tools, as well as text messages and visual AI tools are available to train our students. Where we are using, as a teacher, we are using the AI tool to improve the day-to-day work, also to prepare content for the teaching, and also helps students as well as the university or maybe the college administration to prepare the documents. Okay, there are 10 major advantages of AI in education: personalized learning, task automation, and you can create smart content creation for the teaching, improved accessibility, closing skill gap. You don't need to assess the student when you put the data inside the AI. It will analyze the student's capability, their skills, everything, knowledge, attitude, perception, everything. It will provide the data. Based on the data, you can customize your lecture notes and you can deliver. So it will close the gap. Data-based feedback will be provided by the AI, and also it will complement the teacher by providing appropriate suggestion to improve the lectures, as well as 24/7 tutoring and also assessment integrity. We can use the AI for assessment as well. As I mentioned, we can use the intelligent tutoring system to train our students, to teach our students, as well as automatic grading system. Okay, we no need to do anything. Even the AI will prepare the questions, just have to conduct the exam. Okay, AI will analyze all the answers, provide the grading, provide the feedback, everything. So in future, the only thing we have to conduct the exam, but everything the AI will do. Okay, and we can use AI for curriculum planning, learning analytics, as well as content recommendation in terms of curriculum preparation. And with the help of AI, we can be an intelligent tutor. At the same time, the student can be an intelligent tutee. In future, everyone will be powered by AI or enabled with the AI. Okay, and we can use it for policy making in higher education. So coming to the advantage of AI, and as a teacher, instead of going for conventional blackboard or whiteboard teaching, as a teacher, we must be enabled to train the AI application. AI will not train you. We need to train the AI. If you train the AI, training the AI is not very big deal actually. Preparing a keyword, suitable keyword, okay, to prepare the content. So you need to be a model to train the AI, thereby the AI will prepare the answers. Okay, we used to say it's training the AI. And also we have to provide the feedback to the student, feeding the information to the AI for the professional development and also to get your student information as well as the behaviors. Then to check the accuracy of the information, whenever the AI providing the data, we need to check the accuracy of the data, whether it is appropriate or not. Okay, so for that we need AI and we need to be a role model. Then determining the assessment criteria, we need to prepare a assessment criteria what need to be tested with the student. AI will not suggest anything, but we have to prepare a criteria for the assessment. Thereby we can train the AI. AI will prepare everything. Okay, with all this information, once we feed it in the artificial intelligence tool, we can use it for planning the content, implementation of the content, as well as assessment. At the end of the day, the AI will provide the feedback. Based on that, we can improvise or improve our, the keywords or maybe the AI. Thereby, the AI will provide more effective information or accuracy of information. For the students, when compared to the teacher, the students are double time more benefited. You may think why Dr. Palni put 2 times benefit for students, because when compared to a normal human being, the students are more benefited with the AI powered tools. They can use the AI for education at any time. They can use any platform for preparing notes and also assess the notes. And it can act as a virtual mentor. Maybe in future, the faculty may fail to provide the response, but the AI never fail to provide a response or a feedback through the assessment. Okay, the AI will provide the feedback. Based on the feedback, you can modify your method of learning. Okay, so whether you want to
Another
read,
2 minutes to wind up the session,
yes,
sir.
sure. Okay, so we can use it. Then for the benefit for the students, you can see AI can be a tutor and AI can assess the students' health as well as data-driven policy. The study says that 35% of college students are using AI to create a solutions. At the same time, 62% of students believe that AI is very good for the higher education. Okay, so these are some of the benefit for the students. And what are the problems? Not only for the students as well as teachers, AI is very good for the university to prepare a centralized information. Thereby, they can prepare a very good atmosphere, very good curriculum based on the students' feedback as well as their educational outcome. Then, what are the challenges? You can see some of the items here. I want to show you. Even though most of the AI apps are developed by China, they think that the universities should have restriction in AI used by the students. We cannot give more, priority for AI use. So there should be some restriction. Again, they say the students using artificial intelligence to cheat assessment is a very big problem. Most of the time, the students are creating the content, synthesizing the content by using the generative AI. That should
Sir?
be restricted.
Sorry,
Yes,
sir.
sir.
Due to time restriction, the time is up, sir.
Okay, I will conclude.
Okay, sir.
Just I recommend because maybe, okay, I'll talk later.
Sorry for the inconvenience, sir.
Okay, thank you.
Quickly come to a conclusion. Dr. Swami, are you available? Did he? Questionnaire session. Yeah. Really, it is an interesting topic. I think the youngsters, those who are sitting over here, it is really a big alarm to you that artificial intelligence, which will be a true replacer for the youngsters, those who are looking for serious for their job. So, such kind of a scientific platform, really, you have to utilize it. And I really thank APSE for arranging such a wonderful conference so that the youngsters can understand better way what the current and the future scenario when you come for the place of a job. Really, thank you so much. And it's in my mind, it may be a debate we can take into that. Like how far the intellectual ideas may be affected just because of this artificial intelligence of a student. Because everything is ready to use it. It's nurturing in my mind how far the intellectual thinking of a student may affect. It's open debate, I think. The speaker, if he can answer. Okay. I think Professor Sandhya is add to this question.
See, our National Education Policy 2020 envisage on multidisciplinary education. I feel we are truly in multidisciplinary area. What an amazing talk by Palani Swami. Even though he is from pharmacy practice, he has nicely presented what is AI, what are the various tools available in the AI, the applications of AI. It's wonderful presentation from Palani Swami. Hearty congratulations to you, sir. Thank you.
Thank you. On behalf of APSE, a big round of applause to Dr. Swami for giving such a wonderful talk. Let us move to the next.
Thank you, sir, for an informative session. It's a pleasure to have Dr. Palani Swami Sivanandi, sir, with us today. Thank you, sir. I now welcome Mr. Sachin S. Marihal, sir, co-founder, SAS Pinjra Life Science Private Limited, Belagavi, Karnataka, for a talk on digital innovation tool pharmacodia, global database for a faster R&D. I request, sir, to kindly occupy the seat on the dais, and I request the chairpersons to kindly introduce our speaker.
To press which one?
That is like this is front, sir, this is back, and this is the laser.
Okay.
Yeah, Mr. Sachin Marihal is with us. He's a co-founder of SAS Pinjara Life Sciences Private Limited, Belagavi, Karnataka. Over the 13 years of his experience as a project management and business development strategy, he contributed to 14 R&D and then NDA projects for clients like AstraZeneca, GSK, and Otsuka. His area of research interest is like formulation research and development, generic and investigational new drug development, and as a scientist, we have gained some 5 different articles he authored as a as a first author, as well as he has achieved as well as received various awards from GSK, AstraZeneca, and Dizal for his project-related work. And also he's a holder of a gold medal for the best performer at Uzi AppTech. I guess I spelled in a right way?
Yes, it's right. Uzi
Thank
AppTech.
you.
Yeah.
Over to you, Mr. Sachin.
Thank you, ma'am. Thank you for the introduction. I hope my voice is clear to everyone who is sitting in the shadow. Just raise your hand if you're hearing my voice loud and clear. Yes, yes. Okay, thank you. So, before I start, I'd like to thank Sarada Vilas College of Pharmacy for having the host and doing such a wonderful conference that is focusing only research. That's what APSE is about. So we are talking only research. Okay, so ma'am, with your permission, can I start my presentation? Okay, so hi guys, I consider all you as friends, so let us keep it a friendly discussion, and I hope you can learn a lot of things what I'm going to say. So finally, this is the last session. I think a lot of you guys are relaxing and it is going to come to an end. So please, last but not the least, so please pay attention because I'm going to talk very basic, very simple, which can go into your mind. And I think if 1 or 2 of you can get to understand what I'm saying, I think my job is well done by speaking today. So AI, we heard from the first topic till the last topic, AI. You're hearing about AI, ChatGPT, DeepSeek. So there are so many things people are talking about AI. What is artificial intelligence? I think Dr. Palaniswamy sir has already told what is AI, how it is going to play a role in your day-to-day life, apart from the healthcare. So AI is nothing but an artificial intelligence. You know it very well. It's a software. And we are, who are we? We are pharmacists, right? So we don't have that knowledge of technology, but everyone is talking AI, implement AI. So let me talk to you about a tool which is already using AI and how it is going to help for your research. So before getting into that tool, let us understand who we are first. So I'm going to talk about Advantage India as in healthcare. So who we are, we have to understand first. Okay. So this is something I always put it in my slide. We all belong to a noble profession, that is pharmacy, because we take care of human life. We are dealing with the most expensive or not valuable thing that everyone is paying money, that is life. So you have to be proud that every single thing you're doing, even your studies, is going to contribute tomorrow. That's going to have a very noble cause. So we should be proud, and what I say, we are proud. So that is what I want to say. If some of you have come by chance to pharmacy, some of you decided to come to pharmacy, the industry is very big. I'm going to show you how big is the industry. You can see the points here. Pharmaceutical industry is an important industry concerning the human life and economic development. We are also playing a very critical role for the growth of our country's GDP. So pharmaceutical industry in aggregate is the third most valuable in our economy. So IT, I think the agriculture, and then comes the pharmacy. We are one of the biggest, third largest contributor for the Indian economy. You can take it also for the global economy. So global pharmaceutical industry, 1.6 trillion. It's the size in 2024, that's last year. We just entered into 25 and we will reach 1.99. So the market size of pharmaceutical industry in India is 60 billion, 60.8 billion. So expected to reach 130 billion by 2030. So why I'm going to put these figures is, we are one of the important people in the Indian economic growth factor. You have to understand that. That is the huge potential of this industry. 60.8 billion. Let me explain you. 1 billion was something that was spent by Ambani's for their son's wedding. You know 1 billion, how much it is into crores? 7,500 crores. They say 5,000 crores. So that's the 1 billion. So we are talking about 60.8 billion, and 1,000 billion is equal to 1 trillion. So 1.6 trillion. That's how the value comes here. So these numbers are very important because every country wants to grow, and India is racing to be one of the top 3 GDP for the next 5 years. So once we have understood how big is this industry, let us understand how much important the Indian pharma and biopharma is playing. Okay? Because pharma is divided into 2, pharma and biopharma. So we all come under pharma. Biopharma is like biotech, cell gene therapy and all those things come. So let's see, 60 billion we have already seen the size of industry. We are on the third in volume. Volume means how much tablets you are producing compared to all other countries in the world. So we are in the third place. So 14th in the price of value, means one tablet means 10 rupees. So when you sell those bulk, we are in the 14th value. Growth rate 10 to 12%. Export 27.82. Expected, we are exporting to 200 plus countries. I think that is a very proud thing. As per as 2024, it's 50 countries have been added. Domestic market, India 24 billion. Imports value, so we are importing this API, KSM majorly from China. So that is around 7 billion. See, biopharma industry 49.8. During the COVID, our India, the government got like 7.7 was the billion was the market that, and bio IT research, this is where the AI, drug discovery, everything comes in. So once we know that Indian biopharma and the Indian pharma is playing a huge role. So this means we are heading for a huge numbers coming next 5 to 10 years. This is where you're going to make your career. This is where you want to make money for your livelihood. This is where you're going to gain importance in the next 5-10 years. So let's see where India stands in the Asian. It's an Asia Pacific market, because China, you see the market size, the sales. So USA is around 714.3 billion. That means that much number of medicines are being sold in US, 44.4%. Then comes China, then comes Japan. And you see the Indian is nowhere in the list, but we are in the top 4 in the 4th. See this, why India is not there in this is, India is known as the pharmacy of the world. You all know? How many of you know that India is known as the pharmacy of the world? Just raise your hands, guys. I can't see, just 1 or 2. Okay. I think you will know why India is called as the pharmacy of the world. So in the top 10 pharmaceuticals in Asia, India plays the 4th place. So why? Because we are very good in generics. So this is why this slide gives you more representation or a quick glimpse of the Indian pharmaceutical industry, why we are called as the pharmacy of the world. You can see there down 10,500 manufacturing facilities. That means number of companies. 665 US FDA and CP refers to Europe. After US, India is the only country having the highest number of US FDA approved facilities. That means you have opportunity to work in 665 US FDA if you are making industry as your career. The numbers have gone high. The statistics say that maybe this or next year, India can supersede the number of US FDA approved manufacturing plants than US. That's where India is heading. So 20% of the world population consume Indian generic drugs. That's why we are called as pharmacy of the world. 70% of the vaccines in the world are made in India. I think there are 5 to 6 companies, Bharat Biotech, Serum Institute, Biological E, and there are other fighters. These all companies contribute for 70% of the world's vaccine. Isn't it that very big number that India is taking the share? Now, for the WHO, 90% of the vaccines are supplied from India. That is also, I have not put here, but that's the data. So this we have already seen. Why India is called as the pharmacy of the world. So we Indians, you know, are very good in making generic things. Generic also is not so easy to develop, but generic development comes at a minimum risk. Risk means, for example, I am today putting 100 rupees to develop a product, and my success rate is 60 to 75%. Means I can make somehow the product approved and do the product sales in the Indian market. That is why most of the, you know, Indians, we are jugadus and we want to do somehow get the product to the market. That is why India is been doing very good, because in the generic, because we are in the pharmacy of the world. So, okay. So we are good in pharmacy, generics, we are the pharmacy of the world. We are talking about, you know, so many things. But where do we stand in when it comes to discovery and innovation? Have you asked a question? Because you see today's conference, this 2 days conference is focusing how to promote research. But let's see where India stands in the innovation index. R&D, India R&D costs are 80% lower than those in the developed markets. For example, if US is spending, making 100 rupees profit, 87 rupees is spending for, like for example, 50, at least 50%. But Indian companies are very low, because that is where we don't see the innovation coming in. Global Innovation Index, India is in the 40th ranking. And China is in 12th, USA in 3rd, UK and Switzerland. So USA is responsible for the development of 43.7 of the NMEs. China contribute to 10%. So NME refers to new molecular entity. Parle sir has talked about drug discovery. So when you come out a preclinical drug candidate, it is called as new molecular entity, that's called as NME. So friends, you will be surprised to, or you must be shocked to know that not even a single molecule has been completely discovered in India. Whatever the paracetamol, pantoprazole, vaccine, so and so forth, none of them, no, maybe some Indians outside the India might have developed, involved, but Indians, companies have not contributed, for the innovation or the discovery of the molecule. So the reason, again, I have to say is funding. I told risk. For example, in drug discovery, if I'm putting 100 rupees, 95 rupees, I may lose it, because if the molecule fails, the money is gone, but not like in the generic. At least you can recover 50 to 60% of the money. So that is the problem with the Indian companies. And also, the product development cost for one new molecular entity is 1 to 5 billion, the range I'm giving you. So 1 billion, I've already told you how much it costs, 7,500 crores. Fail hoga to project, pura 7,500 crores goes into the water, and that's a big risk for Indian companies, because some companies, the total net worth itself is 7,500 crores. That's the reason the Indian innovation was not so, but now India is changing. And we all are seeing the change in the Indian research ecosystem, and everything starts from the college. So Government of India has understood this factor very seriously, and Government of India is trying to put money. Agar aapka 90 rupees, 95 rupees is getting loss, government will give you 50. So that means 45 rupees is loss. So they're trying to reduce that burden, but they're pushing the companies to do the innovation. So I have put some initiatives taken from the Government of India. The pharmaceutical innovation landscape in India is evolving rapidly, and we are seeing in the last 2 days. This emphasizes the potential for future growth. With increased research by the Indian companies, startup companies are increasingly aggressively. Government initiatives are coming. Yesterday, the Government of India launched India AI scheme. Anyone who wants to work on AI, you can get money from there. So that's how the current central government is putting a lot of money and advanced digital technologies. So here comes the main point. So the digital technologies, I think Dr. Falani sir was mentioning, it can help you to save time and also help you to make decisions. AI tools can, save a lot of time, because it's in data, it is generating from the data and giving you the report. So that is where the digital technologies plays very important roles, and that is what is the focus of my presentation. What are these digital technologies in the market, how you have to use, and how it can help for your faster drug discovery. So here, Government of India, there's an official gadget, 5,000 crores they have put the money. So you will tell, sir, it is not even sufficient to develop one drug discovery. You're saying 1 billion to whether it is sufficient. I would say something is better than nothing. At least that amount has come out. It can be used for your basic research. It can be used for your proof of concepting. So PRIP is the promotion of research and innovation in pharma sector, is into two, Central of Excellence for R&D and also for the medical device. So, so you can utilize these funds. I think the professors or the universities can take this funding. Then the other funding is the open source drug discovery, OSDD, that is from the CSIR. So I think they have put around 46 million, and I think last year they have already utilized 12 million. So this is something very important required for the innovation funding support. Okay, so now we understood what is India, what India is known as pharmacy of the world. What are we lacking? In the need of R is to do innovation. So the government is giving funding. Let us understand the digital technologies I have highlighted. Before that, let us understand how these technologies play a role in our day-to-day life. Facebook, Bitcoin, Netflix, Instagram. I am sure so many of you are now, swiping Instagram, sitting and looking on your phone. That is the level, even though the topics are going on, you have come, you have paid, you're sitting, but still you're looking on Instagram. That is what the power of this technology. They are grabbing your attention, and it helps to overcome, that feeling. So Instagram was something which I didn't know in my college days when I was working. So these technologies 2008, 9 and 10 were just launched in when I completed my graduation. So now you're seeing these all apps have completely taken your routine day to day. They're taking time. Instagram is taking your time. Netflix, it's taking time. Android, Bitcoin, Facebook, Tesla is not launched in India, but phones. So this is the power of the technology in innovation because it gives you everything in one shot. So once we have understood what has happened in 2008, 9 and 10, so what is going to, what has happened till 24. So these are the things that has been talking the last 3 years. You might have heard talking about AI. Sir was talking about blockchain. He was talking about IoT, Internet of Things. So these are the things which you will be hearing after 10 years, the next 10 years. So these things becomes very important in your routine research, or you have to understand that you have to understand this concept. Understand means you don't have to have a degree or a diploma course. You just have to understand how these tools work. For example, big data and dynamics. So now everything is based on data, man. I mean, any research you do, you need a data. So real world data, that is called as RWD. RWD is the basic core for Amazon. They have a real world data. From that, they are bringing out real world evidence. For example, if I have to make you understand, I have done a clinical study. I have spent 7,500 crores and I have generated a data and my project got failed. That's the data I am having. Tomorrow, someone of you will come and can you give me this data? And you will put it in the AI and you are developing one more product and the AI will say that this guy has made so and so mistake. Because we have evidence, you can avoid these mistakes, maybe clinical data, maybe during development. So this is called as real world evidence. Based on the data of 50, 60 years, what we are doing, that data can help you to avoid the mistakes, error, or it can also give you some suggestion how you can have to improve your development. So data science and analysis, this is also very important topic. AI, machine learning, and manufacturing for digital adoption, IoT, cloud computing, blockchain. And the last one is quantum AI. So guys, you know what is quantum? Quantum dots, quantum physics. Quantum is something which I cannot say, but I'll try. It is 100 times more faster than AI. It's a quantum dot. It's a complete different algorithms. So this is what is going to impact you in the next 10 years. So you have to understand digital tools and how to use those digital tools. It might be, you see, in research, I heard in some topic, if AI is going to replace your job, AI is going to replace so and so. But when it comes to research, AI cannot replace you because it works on your wisdom. AI is a data, especially in research, it will give you a prediction. But how it will predict? Unless until you feed something of your wisdom. For example, you give a structure or you're searching, then only it will give predict. It is just helping you to make decision or it is helping you to make your research faster. So I'll go a little bit fast. So once you've understood the digital technologies or the digital tools play a pivotal role down the line for your research career, I have put some companies here who have already developed some AI drug discovery in pipeline. So AI startups. So these are also AI startup. So investing in drug development is a game. Currently there are new drugs to market and 10 to 15 years according to cancer. So artificial intelligence can help drug discoveries more fast and boost your research. So these are the different tools. So these are also different big companies. You might have Pfizer, Boehringer Ingram. So they all are using AI tools to fasten their research. Okay. So now I told you that we have invested money and that is going to fail. But you see, there are some news in the pharmaceutical industry, that is the healthcare. There is one company called as Shira, $1 billion investment an investor has put. If they fail, that is gone. But investors are taking risk. That means they understand what is the value of developing this product. Similarly, you know, in world, JP Morgan week has happened and they decide what products are developing all over the world. So last January 2nd week, a company called as In Silico Medicine, that is an AI discovery, they have developed molecule, and they sold to Minari for $515 million. Can you imagine? It takes $1 to $2 million to develop a prototype molecule using AI, but they were able to trade it. You see the money involved in this. That's the advantage of the AI drug discovery. So let me quickly, so everyone is talking about AI tools, how it will fasten. I'm going to showcase you one product that is called as Pharmacodia Global. It's an intelligence platform and how we can help you to make decision. I'll move a little bit quick in the interest of time. So this is the general detailed diagram how the drug discovery happens. You see target validation means anything in the lab, you come out with one molecule, okay, say it can treat some respiratory infection, then hits leads generation. So this is a highly challenging area where the research fails, where your $50–60 million get failed. That is where the AI tools can help you to faster. Then preclinical, there are different tools, then comes phase 1, phase 2, then last your products into the market. So the whole process takes around 10 to 15 years. This itself takes around 7 years, this part. So with the use of AI, we can do it in 1 or 2 years. You can save time. So data is critical because based on data, you make the decision. So for data is required for the product development. So data is needed for drug discovery, IND, stay, synthetic routes, so on. So you need a data for doing a drug discovery. You need a data even for the generic. What data is required, patents, everything. So now, Pharmacodia Global Database, this is one of the tool which is AI. So it has so much of information in one place. Like you can see patents, clinical data, CMC, sales, regulatory, the world reg. So you want anything, you just put the name, you type enter, it gives you a report in seconds. If you have to do it on Google search, it takes around 10 minutes. Or if you're an expert, but it takes days if you're an amateur in the research area. That's how these tools. So data needed for new drug discovery, switch to tools which are validated, and the data you get from Google search is unvalidated. The data you get from this kind of databases, validated data. So the same thing answer is switch to the tools. The one I am proposing is Pharmacodia Global. So when you're doing the research, there are a lot of information. Ma'am, I'll take 5 to 7 minutes. I'll quickly finish it off because it's the last one. I don't want them to miss because it's important for their down the line career. So you refer books. When I used to refer articles, search on internet and prepare a report. But in the present scenario, database intelligence, AI enabled, makes significant. So discoveries, happen. I'll just skip that one. So what we are doing right now is search on internet, rely on untrusted data, copy, download, paste, everything. But that still you need to validate. Switching to this AI tools, the AI database, now I'm focusing this topic specifically on the AI database, can help you to give all the information in the right place, in the right format, and in a validated form. Later you do study, you take a reference from Google, this patent which is in application, and it fails. Your money is gone. But the same referencing you take from this data is validated. It is giving a meaningful result because it's a validated data. So what we are proposing, what I'm proposing is, when it comes to research, switch to digital tools, replace Google search with Pharmacodia Global. I'm putting about this product, but you find any other product which is giving you data, switch to this. Don't do Google searching. So there are many, till now I spoke about drug discovery, innovation, everything. That is for the industry. How it is useful for academicians. How you are going to, outcome with very useful publication. So I have put roadmap for grants. Now you see government is giving huge funds. If you write a proposal for AI drug discovery, a proper format, 60 lakhs funding, we can get. I think in the previous speeches, it has been shown. So for advanced innovative research, landscape, disease, target, identify. So there are a lot of things for lead molecule identification, looking forward for research grants, review article and overview article. See, the industry is different. Pharmacovigilance, drug discovery again has synthetic formulation. There are different departments. The commercial department is called as portfolio department. Portfolio departments decide what product the company has to develop and what product they have to launch for the next 10 years. And especially that portfolio is preferred by girls because it's a desktop work, it involves a lot of, so what they do is they take the data, they make some analysis, they may prepare reports and they submit to the management. Okay, so and so data is good and this is going to treat so many patients because that disease is increasing every year. So it could be a good profitable for the company. So you can prepare such reports, everything, landscaping, everything. So I've put up to 50 lakhs funding from DST, DPT, BIRAC, ICMR and CSR, ODD. So you can write a review overview article. I think they can do this quality research, add the academic, simply synthetic, pharmaceutical. So all the data is there. Then why this data intelligence? It helps to improve, to bridge the gap. I use the word as industry ready. See, everything is commercial because that is how it is valued in the market, any product. So you have to be industry, you don't go to industry, but you do academic research which has to be industry ready, then there is a value. I think Roy sir was mentioning, it comes to patents and stop. Nothing is going ahead. So these things will help you to take it to industry, because if I am a manufacturer, pharmaceutical, if you give me, it is good. So, because it has a value. So there are so many advantages. 2 minutes, man, just wind it up. Help the faculty and student updated, then new target indication, then contribution to improve the research output. You can do a lot of things, paper publication, ideas, academic grants, you can write beautiful grants. Then contribution to the revenue generation of the organization. Being in the college, you can consult industry. You can earn money at the degree or the master degree. So this is how, okay. So these are some publication, high impact factor, references are taken for pharmacodia and been published. Is my presentation, can you move it? Yeah, okay. You can write books. I think a lot of books were released. You can write some good books using this data. Next, can you just move it, please? Slide, yeah. So this global database, what to say, it is very flexible, affordable, safe. Somebody says there is some safety concern, ma'am, because I think you mentioned we have to debate. It depends on the company, ma'am, who is doing that database, because they have the control, because nowadays the Data Protection Act is very strict in each country. The Facebook faced some issues. So any data is there that will be protected and that is the user protection, what we say. So that is how it makes it safe, reliable, user comfort. And there are also different other similar platform, Web of Science, you can do for articles, Scopus, Cotiles, CES. So these are all like different benefits. It can be cover wide range, enhance your strong visual analytical tools, email alerts, decision making based on data. That's what is the end. There is a data, you can make decision based on that. So I'll stop here because I just wanted to show you how this platform is built. Lot of information we take, and we put it in a machine learning model, and then that gives the, so here is what we involve. So that is how the research happens. So some CAR-T therapies, they take your own blood.
Sorry to interrupt, yes, we are running out of time.
Sure. So I'll stop it here, guys. So my end message is be alert in the market dynamics. This is an industry which can pay you a huge salary if you're updated with such kind of tools. So make sure you're updated, have fun during your college time, but at the same time pay attention, because things are moving fast. You need to be in that pace. So with this, I thank, and I once again thank Sarada, Vilas and APSE for giving me this opportunity to speak. I look forward, you can take my name, Sachin, you can contact me, I can help you with what I know. And I hope you guys come out with good knowledge and get into good industry, and also have your own startup. That's most important. Thank you, everyone. So any questions, please?
Any questions from the audience?
So guys, be free, even it is simple,
yeah.
Ask me.
Okay.
Don't hesitate.
Thanks to Mr. Sachin for giving an overview about the pharmaceutical industry and the importance of AI in the pharmacy. From the morning we are listening, the talks about the various AI tools and the AI interventions in drug discovery, gene mapping, drug gene gene disease associations. I think it's the right time that the pharmacy students should learn about AI. Somewhere the AI needs to be introduced in their regular curriculum. At least the introduction of the AI seems to be very much required even for the pharmacy students as well. With this small note, I thank Mr. Sachin. A round of applause to all the.
Thank you, ma'am. Thank you so much. Thank you guys for your patience listening. Yeah.
Thank you, sir, for an informative session. It's our pleasure to have Mr. Sachin S. Marial, sir, with us today. I request sir to kindly accept our token of appreciation, and I request our chairpersons to do the honor by handing over the memento to sir. Thank you, dignitaries. I also like to thank Dr. Manasa Deepa ma'am and Dr. P. Sandhya ma'am for chairing the session. I request Dr. Subhash C. Marial sir and Anil Kumar Randiv sir to hand over the memento and honor our chairpersons.
Thank you, dignitaries. Good afternoon, one and all. I welcome you all to the valedictory event of International Conference on Translation of Value Education and Innovations in Health Sciences for Societal Transformation. My request, the dignitaries to kindly occupy the dais. A very good afternoon, one and all. Every ending is a new beginning. As we conclude this conference, let us carry forward the knowledge, inspiration, connections we have gained, turning them into action for a brighter future. With this, I welcome you all to the valedictory function of the International Conference on Translation of Value Education and Innovations in Health Sciences for Societal Transformation, organized by Vilas College of Pharmacy, Mysuru, in association with Association of Pharmaceutical Scientists and Educators. With this, let's begin this wonderful event by invoking God's blessings. I welcome Ms. Nisarga and Ms. Aishwarya for an invocation.
ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿಹನಾರಮ್ಮ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿಹನಾರಮ್ಮ ಕಮ್ಮಗೋಲನ ವೈರಿಸುತನಾದ ಸೊಂಡಿಲ ಹೆಮ್ಮೆಯ ಗಣನಾಥನೇ ಕಣಮ್ಮ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿಹನಾರಮ್ಮ ಮೋರೆ ಕಪ್ಪಿನ ಭಾವ ಮೊರದ ಗಲ್ಲದ ಗಿವಿ ಕೋರೆದಳೆಯ ನಾರಮ್ಮ ಮೋರೆ ಕಪ್ಪಿನ ಭಾವ ಮೊರದ ಗಲ್ಲದ ಗಿವಿ ಕೋರೆದಳೆಯ ನಾರಮ್ಮ ಮೂರು ಕಣ್ಣನ ಸುತ ಮುರಿದಿಟ್ಟ ಚಂದ್ರನ ಧೀರತ ಗಣನಾಥನೇ ಕಣಮ್ಮ ನಮ್ಮಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿಹನಾರಮ್ಮ ರಾಶಿ ವಿದ್ಯೆಯ ಬಲ್ಲ ರಮಣಿ ಹಂಬಲನುಲ್ಲ ಭಾಷಿಗನಿವನಾರಮ್ಮ ರಾಶಿ ವಿದ್ಯೆಯ ಬಲ್ಲ ರಮಣಿ ಹಂಬಲನುಲ್ಲ ಭಾಷಿಗನಿವನಾರಮ್ಮ ಲೇಸಾಗಿಸು ಜನರ ಸಲಹುವ ನೆಲೆಯಾದಿ ಕೇಶವದಾಸ ಕಣೆ ಅಮ್ಮ ಅಮ್ಮ ಶಾರದೆ ಉಮಾ ಮಹೇಶ್ವರಿ ನಿಮ್ಮೊಳಗಿಹನಾರಮ್ಮ 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 ನಿಮ್ಮೊಳಗಿಹನಾರಮ್ಮ. ಧನ್ಯವಾದಗಳು.
Thank you, Nisarga and Aishwarya, for a melodious invocation. May I now request Dr. R. Nagendra sir to kindly welcome our guests and gathering.
A very pleasant good evening to one and all gathered here. On this auspicious occasion, I would like to welcome Dr. B.M. Subraya sir, President Sarada Vilas Educational Institutions, Mysuru, who has been a great support to us in all our endeavors. A pleasant welcome to you, sir. I would like to welcome Chief Guest of today's function, Dr. Milind Parle sir, President, Association of Pharmaceutical Scientists and Educators, India. A hearty welcome to you, sir. It's a great pleasure to welcome our guest of honor, Shri R. Dinesh sir, Honorary Secretary, Sarada Vilas Educational Institutions, Mysuru, who has been support to us throughout this event. Welcome you, sir. I would also like to welcome Dr. G.L. Shekhar sir, GC member, Sarada Vilas Educational Institutions, Mysuru. We are immensely happy to have you with us. Welcome you, sir. I would like to extend my warm welcome to Dr. Nirmal Singh sir, Professor, Punjab University, Patiala. We are honored to have you with us. Welcome you, sir. I would also like to welcome Dr. Anant Nayak Nagappa sir, Advisor, International Journal of Community Pharmacy. Welcome to you, sir. I would also like to welcome Dr. Subhash Marihala sir, Advisor, Indian Institute of Information Technology, Dharwad. It's a pleasure to have you here with us on this occasion. Welcome to you, sir. I also welcome Professor Venkatesh sir, Organizing Secretary, APSECON25. Welcome you, sir. I now take pleasure to welcome Dr. H. Joshi sir, our beloved principal, Sarada Vilas College of Pharmacy, Mysuru. A welcome to you, sir. I would like to welcome all the teaching, non-teaching staff, press and media members, the delegates from different colleges, faculty members, and all the resource persons for this valedictory ceremony. Welcome you all. Have a nice time.
Thank you, sir. A warm welcome to you too. May I now request Dr. Jinesh B. Nagavi sir, HOD, Department of Pharmaceutical Chemistry, Sarada Vilas College of Pharmacy, Mysuru, to kindly present the report on the conference to our gathering.
A very warm good evening to one and all. Respected dignitaries on the dais, on behalf of the organizing committee and scientific committee services for APSECON, I, Dr. Jinesh Nagavi, Professor and Head of Department of Pharmaceutical Chemistry, take this opportunity to give a detailed report of the 2 days event on International Conference for Translation of Value Education and Innovation of Health Science for Societal Transformation, held on 30th and 31st January at Sarada Vilas College of Pharmacy in association with APSE. Sarada Vilas College of Pharmacy, along with the Association of Pharmaceutical Scientists and Educators, have embarked on an insightful journey on translational value education and innovations. Connecting with great enthusiasm, the conference spanned for 2 days, offering an immersive exploration of various themes through plenary talks and scientific sessions delivered by esteemed national and international speakers. The conference also unfolded with a meticulously curated schedule, which was designated to guide participants systematically through the diverse spectrum of themes. We have health sciences, we had Indian knowledge, drug discovery, process research, pharmacovigilance, pharmaceutical care, and drug safety. On the day one of the conference, we had registrations of over 700 participants, comprising of resource persons, delegates, academicians, industrial experts, and students. The day one commenced with scientific sessions with Dr. Arunachalam Muthuraman, Associate Professor in the Department of Pharmacology at the Faculty of Pharmacy from APSE University from Malaysia. He delivered a talk on current prospects of natural irisin modulators in the management of diabetes retinopathy. At 10 o'clock, we had an inauguration function which marked the beginning of the transformative conference, extending a warm welcome to participants, setting the stage for engaging and learning experience. The esteemed guests were Dr. Subarna Roy, Director from ICMR NITM Belgaum, who inaugurated the event, setting the stage for the enriching experience. The chief guest for the conference was Mr. Professor M.R. Gangadhar, Honorable Vice Chancellor from Chamraja University, from Chamarajanagar. He enlightened the participants, along with the dignitaries, Dr. Milind Parle, President of APSE, Sri R. Dinesh, Honorary Secretary of SVEI, and Sri S.L. Ramachandra, GC member of SVEI, were present. The inauguration was presided by Dr. H. Joshi, Convener APSECON and Principal of Sarada Vilas College. In the inaugural function, the APSE Global Pharmacy Educator Award 2024 was honored to Dr. Nirmal Singh, Professor, Department of Pharmaceutical Sciences and Drug Research, Punjabi University, Patiala. The inauguration witnessed release of conference proceedings, textbooks on pharmacognosy and pharmaceutical jurisprudence. At 11 o'clock, we had a session by the keynote address by Dr. Subarna Roy, who is the Director of ICMR NITM, on the translation of innovations in traditional medicine and AI and digital technologies. The session was chaired by Dr. Narayan Hegde, the Senior Consultant Plastic Surgeon of Apollo Hospitals, Mysuru, and Dr. Nirmal Singh, Professor from Patiala University. The scientific sessions continued with exemplary topics like the relevance of value education for the societal transformation by Dr. Milind Parle, and translational research on pedagogy, a transformative approach to experiential learning and science, communication through Socratic education by Srinivas Patnala. The sessions were chaired by Dr. Nagappa and Dr. Harsha Hegde. At 12:45, the oral presentations were done by faculties and research scholars on diverse topics like herbal drug technology, preclinical evaluations, cancer research, and drug utilization from various institutions around the country. At 2 o'clock in the afternoon session was focused mainly on the research insights by Dr. Pradeep Singh Negi and Dr. Kiran Kumar Huleti. The subsequent sessions were engaged by Dr. Harsha Hegde on the topic of bioprospecting, translating medicinal plants into therapeutic innovations, and by Professor A.K. Gnanachandran, Principal, Pranav Institute of Pharmaceutical Sciences and Research from Gwalior, delivered a talk on understanding allergies, causes, symptoms, types, and treatments. At 4:30 on the first day, that is 30th January, we had in the evening mesmerizing and flashy cultural events by the students of Sarada Vilas College of Pharmacy. The day 2 on Friday, that is today, 31st January 2025, the day started with the oral presentations in the Centenary Hall by the student delegates on various topics like practices of contraceptives, neurodegenerative disorders, patient safety, and GPS solutions for dementia management. At 10 o'clock today, 31st January, we had a talk by Dr. Shailendra Gurau on Ayurveda biology and integrative approach in health management. We had a session by Dr. Nirmal Singh, phosphodiesterase as an interesting drug target in dementia. The session was chaired by Dr. A.K. Gnanachandran and Dr. Devika. At 11 o'clock, we had a session from Dr. Banappa Ungar on zebrafish models, on metabolic disorders, on herbal drug research and development. We had also a session on digital innovations, the CyberAid AI tool for screening innovations, drug targeting, and designing molecular structures by Mr. Anil Kumar Randev, Chief Scientific Officer of SAS Pinjara Life Sciences. The sessions were continued in the afternoon by the topic Translating Innovations in Antimicrobial Stewardship by Dr. Samir Dhingra, who had joined online. He gave a talk, and followed by that, Dr. Palaniswamy Shivanandi from Kuala Lumpur, Malaysia, gave a talk on artificial intelligence in higher education challenges and opportunities. The sessions were chaired by Dr. Sandhya and Dr. Manasadeepa. We had an excellent talk by Dr. Sachin Marihal on the topic of digital innovation tool Pharmacodia global database for faster R&D. The organizing committee, along with Scientific Services Committee, extends a great appreciation to all the guest speakers for sharing their expertise. Along with the scientific sessions, the two-day conference also witnessed parallel online and offline e-posters and oral presentations by the student delegates, faculties, and research scholars. We had almost more than 100 oral and e-poster presentations by the students and research scholars. This is as per the conference report. We hope you all will take back a great memory and with scientific knowledge. We hope you had a pleasant stay in Mysuru and hope you enjoyed the hospitality of Sarada Vilas College. Thank you one and all.
Thank you, sir. May I now request Dr. Anant Naik Nagappa, sir, Director, Om College of Pharmacy, Ranebennuru, to release the International Journal of Community Pharmacy, the official publication of Association of Community Pharmacists, India, South India branch. It is an international journal with an ISSN number published by Association of Community Pharmacists of India from past 17 years. I request Mr. Amit Nair of 6th Pharm D and Ms. Pratiksha P of 5th Pharm D, who are also the members of the editorial board, to present the journals to our dignitaries. Thank you, dignitaries. May I now request Dr. B.M. Subbaraya, sir, President, Sarada Vilas Educational Institution, to release the special edition of the International Journal of Community Pharmacy, and I request the dignitaries to join the same. request Dr. B.M. Subraya Sir, President, Sarada Vilas Educational Institutions, to kindly address the gathering.
So very good afternoon, good evening to all of you. Respected dignitaries on the dais, Dr. Shekhar, our GC member and educationist, Secretary Mr. Dinesh, Dr. Milind Parlin, one of the best scientists in India, Dr. Nirmal Singh from Punjab University, and other dignitaries on the dais. My fellow students, delegates, and other dignitaries, it is my pleasure to be here. First of all, on behalf of the Sarada Vilas Educational Institution, I thank the organizers led by Dr. Joshi and all the speakers who have done a wonderful job in interacting with the delegates and at the same time presenting their innovations and also whatever that achievement they have done in this particular conference. Friends, valedictory of a conference or any other function, automatically it brings to my notice that always I believe and I tell the participant that since 2 days you have really spent a lot of time, and whatever the time spent, it has to be productive, and I hope it is really productive. And at the same time, there could be few takeaways. At least I believe and I trust you had to consider 1 or 2 or 3 takeaways. Not more than that, at least 1 or 2. Go back and then see, is it possible to implement it in the same way? Implementation means what? It could be simple, study on that. Is it possible to go to the next level? If not, tell your friends, tell your colleagues, tell your partners, yes, you have attended this particular conference. These are the best of the best conference. These are some of the excellent speakers we interacted. Going forward, probably you can go and then interact with them also through email or whatever that is. So like that, you can think about that is how to take good out of any conference. That is, I believe, that is first part. The second part, I really like the title of the conference. That is, one is, there are 2-3 important words. Always I keep talking about that. One is on the value education and how this value education can transform probably in a specific area that you have picked up as the health sciences and also societal requirement. Of course, so when you just looked into your probably the previous generation or 20 years, 30 years, 40 years back, the value education, of course, that is the education, of course, you used to impart. But today, the value education has taken the back seat, and always we try to educate ourselves in one way or the other way for a very microscopic benefit, not looking at the societal level, not looking at the holistic way. Friends, the value education is really important, but at the same time, how we are going to impart and how we are going to implement it, how we are going to transform our society, it is a big challenge. It is not so easy. I believe that is, in my thinking, always I believe the individuals, as a student, as a delegate, or as a professor, as a faculty member, as a scientist, whoever that is, they have their own principles, values. That is, it is inherited in your own way. And at the same time, where you are studying, where you are working, or where you are studying, you are working in which domain, has its own value system. And if those two are aligning, probably it's a good marriage, and then this value education probably we can evangelize to each and every other folks. Otherwise, it's really difficult. In a corporate parlance, we keep talking about value system. Unless otherwise, the value system and individual and others, if it matches, it is very difficult to drive. Exactly in the same way, tomorrow you are going to be appointed in various pharmaceutical company or any other organizations. Unless otherwise these two marries, it's difficult. Hence, this conference, international conference, of course, so it's a very good conference, no doubt about it, and talks about the core engine about value education. So I believe that is, it has succeeded, and then you acquired at least a few cents out of that. Coming to the pharmaceutical conference, and the previous speaker was talking about AI, talking about the technology, digital space, etc. I'll just quote an example that is probably how the world is moving. Simple example, which is really required for the society. Yesterday I was in Bangalore, and then I was talking to a group of youngsters who has a simple, small startup, particularly in health sciences. That is, they looked into the society. In the society, there are certain challenges they're facing, and they looked into the individual domain, that is probably an allopathic medicine, or the traditional medicine, or whatever that is. And then the society, of course, it is a simple disease to a very complex disease, like cancer, tuberculosis, whatever that is. So if these two, if you are looking at it, there is a traditional medicine is available at the same time, and here there's a formal medicine available. And whenever whoever go and then meet any doctor, always he looked into his domain. That is, if I am an allopathic doctor, of course, I prefer to provide medicine in that area. And if it is a homeopathic, I prefer in that area. Probably if I am an Ayurvedic doctor, I prefer that. But as a society member, I need something different. Is there any way, is it possible to innovate it and then say, is it possible to align? This group of small startup company, a group of people who consist of engineers, who consist of pharmaceutical graduates, and also doctors. So they said that is, okay, it is not a problem. So first thing is, we'll try to analyze the problem, the disease, and then if it is really required for the, let us say, allopathic, not a problem, we'll identify the right doctor and then provide the allopathic medicine up to a certain level. We'll watch it out, we'll monitor, we'll see that, and when it reaches that, probably later on, after that, probably it may require another traditional, probably a homeopathy or home medicine, probably Ayurvedic. So that we'll see, and then we'll provide that. In a sense, here, the intermediary, that is, they're looking at, whatever it is best for the customer, what is best for the client, what is best for the patient. So that is, they wanted to provide that. It is a huge, a good achievement. They have succeeded. They have tested in Bangalore. They have associated with many industries. Yesterday, when I saw that, and then when I looked into that, I requested them to come to Mysuru and then to our institute and then present their cases. So the point is here, is there any way that you can bring in value to the client, value to the patient, value to the society? So that is what we want going forward. So once again, so thank you very much for inviting me for this particular validatory function. I thank Dr. Joshi and his team. They have done a wonderful job, and they're continuously doing a good job. And going forward, if you need Dr. Joshi, any help from this, that if you wanted to take this conference to the next level, if you wanted to create a center here, if you wanted to create a, let us say, a technology as well as pharmaceutical, as well as whatever that is in your own field, if you wanted to create a best of the best excellence center. And here the Sarada Vilas Education Institute, we are going to help you, we are going to support in all respect. Once again, thank you very much, all the best.
Thank you for your words of encouragement, sir. May I now request Dr. G.L. Shekhar, sir, GC member, Sarada Vilas Educational Institutions, Mysuru, to address the gathering.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Distinguished members of the dais, and my very affectionate students. I have been given only 5 minutes. Being a professor, I had to manage within 5 minutes. Professor Subraya also managed within 6-7 minutes. He was also a professor once upon a time. Just I would like to, at the outset, I would like to congratulate the organizers for having ventured into conducting an international event. Ventured into. It is very difficult to attract people from different parts of the world and the country and call the conference as international. These days you have many international conferences, and he has put in a great deal of effort in terms of inviting people from other countries and other states, and I am seeing good number of participants, and that itself is an achievement. So congratulations to you, sir. I am equally very happy. I asked him as I entered, do we have audience to listen to us? Normally, during the concluding session, there will be hardly 10 or 15, but I don't know whether you have been forcefully sitting or you are really interested to know the subject, and at least I am happy I am seeing a lot of people. Just to give my background, as I quoting one or two examples, I studied in Masters in IIT Kanpur, PhD in Indian Institute of Science, and I'm basically a mechanical engineer, and I was principal of the National Institute of Engineering. Artificial intelligence, as I am concerned, this Professor Subraya will watch with me because he studied in IIT Delhi. So 86, 88, when I went to do my master's, a group of researchers in computer science, they are working in an area called AI and ES, Artificial Intelligence and Expert System. That was way back in 1986. ES stands for Expert System. It was very simple. You conceive that you want to design an aircraft. From pharma, I am coming to my area. You have decided to design an aircraft with your own specification. All that you have to do is give the specification. Fraction of a second, I used to see way back in 86, 87, the entire design of an aircraft. All of a sudden, this AI went into lumber state. So there was nobody was talking about AI. In fact, it was India which thought of this, and way back in early 90s, I should say, they established what is known as Center for Artificial Intelligence and Robotics, CARE, in Bangalore under the supervision of then very well-known professor by name Vidyasagar. All these things in early 90s. But all of a sudden, nothing happened because we did not have the power to store the data. Then over a period of time, lots of data mining, data stuff came into picture. Storage started taking its own shape. Then AI again took the rebirth and started providing you lots of, I should say, I don't call it as solutions, lots of, in the form of information it has started giving you. But who built this artificial intelligence? It is the experts whose domain has been captured and put it into some algorithm, and you have the very good computers to run it, and you are getting the so-called solutions. So in a way, AI and ES is not, AI especially is not new to this, but unfortunately, now I'll plug upon this because I'm seeing lots of youngsters. Unfortunately, India did not take it forward. It stopped at that stage. My dear young friends, especially young friends, please listen to this. Just 2 days ago, you saw if at all, if you have the habit of reading the newspaper, I know most of you are very comfortable in seeing some messages and some small news items here and there in your mobile. Just 2 days ago, please listen to these, get yourself motivated. One company called DeepSeek, it butchered the entire world in less than 2 minutes. What do I mean to say that? I'll quote some figures. Just 2-3 days ago, DeepSeek is a China-made company that released the AI open tool. Within no time, NVIDIA market fell down. The overall loss with only 1 or 2 companies in the US is equal to, in one day, in less than 5 minutes, was $108 million US. That was the crash. That was the loss. $1 billion is equal to, as of today, if I take $1 is equal to 87 rupees, that is 8,700 rupees. Crores. 1 billion is equal to 8,700 crores. What was the loss in 5 minutes, day before yesterday? 108 into 8,700, which is equal to 939 lakh, 939 lakh crores. 9.39 lakh crores. What is the budget of Karnataka? 4.1 lakh crore. So what was the loss? 2.2 times the budget of Karnataka was the loss in just 5 minutes, just 3 days ago. That is because of DeepSeek. There is a very young girl in the DeepSeek. Okay, it is she who came out with that fantastic solution. Within no time, she has been offered a job by another competitor in China, 29 or 26-year-old. I read this in the morning, and she has been offered a salary of $100 million. 1 million is equal to 8.7 crore. 100 million is equal to 870 crore. Is the salary that she has been offered. So why I am telling this is, technology matters a lot. You would have heard small things yesterday and today. Please concentrate on 1 or 2 things. Today you may feel, ಒಂದು international conference ಮಾಡಿದ್ದಾರೆ, I don't know, ಜೋಶಿಯರ್ ತಮಾಷೆಗೆ ಮಾಡ್ಕೊಂಡ್ರು, ಅವ್ರು ಜೋಶಿಗೆ ಮಾಡ್ಕೊಂಡ್ರು ಅಂತ ಅನ್ಕೊಂತಿರ್ಬೇಕು. Please carry home something that is very interesting. Work on that for next 5 years. It takes you somewhere else. You will become one of the top-notch technologies, come an AI expert or you use of expert, and you really flourish very well, because I myself couldn't work in the area of AI and ES during my PhD work. I worked in the area of heuristics. That gave me immense satisfaction, and that was first of its kind. And to be very honest with you, not to boast, I got the gold medal for my PhD thesis. So please, youngsters especially, look at the technology, look at the social service that you are doing, and end of the day, look at your pocket, you carry a lot of money. Thank you very much. Thank you very much for giving this opportunity. Bye-bye.
Thank you, sir. Achievers must be recognized with recognition and encouragement for their efforts and perseverance. May I now request Dr. Subraya sir to honor our winners of oral and e-poster presentations. Firstly, I'd like to welcome Snehashri K.A. of 6th PharmD, Sarada Vilas College of Pharmacy, Mysuru, for winning first prize on the topic Toxicity Profile related to immune checkpoint blockades. Thank you, sir. May I now request Dr. Milind Parle, sir, to hand over the prize to Ms. Mamata G, faculty member of Farooqia College of Pharmacy, for winning second prize in the oral presentation for the topic Exploring Soluble Epoxide Hydrolase Inhibitors for Alzheimer's Disease, a preclinical evaluation of Nigella sativa. Thank you, sir. May I now request Shri R. Dinesh, sir, to hand over the prize to Mr. Rakesh S.A. for winning third prize in the oral presentation for development and optimization of topical nanoformulations of Adima cordifolia bark and leaf using central composite design. He's a research scholar from Parul University. Thank you, sir. May I now request Dr. G.L. Shekhar, sir, to hand over the prize to Mr. Pranav Joshi, who won first prize in e-poster presentation for the topic Isolation and Identification of Bacteria from Different Environment of Hospital. He is from BLDA, SSM Corp and RC Vijaypur. He is a PG student. Thank you, sir. May I now request our principal, sir, Dr. H. Joshi, sir, to present the prize to Ms. Shobita Naveen K. from Sarada Vilas College of Pharmacy, who won second prize in the e-poster presentation for the topic Exploring Gel-Based Topical Treatments for Skin Cancer, Safety and Efficacy, a Review. She is a PG student. Thank you, sir. May I now request Dr. Nirmal Singh to hand over the prize to Ms. Kulsum Fatima, who won third prize in e-poster presentation on the topic EEG-based signal analysis for early detection and classification of dementia, a statistical approach. She's a research scholar from Vishweshwaraya Technology University. Thank you, sir. Thank you, dignitaries. I once again congratulate all the winners. It's a proud moment to have Dr. Milind Pale, sir, President, Association of Pharmaceutical Scientists and Educators, Guru Jambeshwar University of Science and Technology, Hisar, with us today. I request sir to kindly occupy the front seat and accept our small token of appreciation. I request the dignitaries to do the honors. Thank you, sir. Thank you, dignitaries. It's a pleasure to have Dr. Marihal Subhash with us today, who has recently been nominated as an advisor of IIIT. I request sir to kindly occupy the front seat and accept a small token of appreciation. We congratulate sir upon getting nominated as an advisor. I request the dignitaries to do the honors. Thank you, sir. Thank you, dignitaries. May I now request Dr. Milind Pale, sir, to address the gathering.
Thank you so much. I am overwhelmed, The okay, APSE, Association of Pharmaceutical Scientists and Educators. This body, you know how it was constituted? Just a few years ago, all of us were affected. In 2020, we had a pandemic, Corona, and the students of Sarada Vilas College of Pharmacy, BPharm students, MPharm students, were all confused because there was a lockdown, not only in Mysuru, all over India, all over the world. We had a lockdown, there was a threat of death, but I got a phone call. Hanmantachar Joshi happens to be my student. He said, sir, what should we do? I am for the students. I want to help the students. And then I was in Haryana that time. I said, yes, I also want to help the students. Let us form an organization. Let us form an international organization. This is the 5th year. We constituted in 2020. We started online classes. We conducted 35 international events for BPharm students. I remember I was covering topics of the syllabus online. We never knew, Zoom, Google Meet, all of them have taken birth after Corona. And this is how this body was constituted. Corona period is over. We are back. We conducted 3 physical conferences then, offline. First was in Nainital. Second was in Kerala. Dr. Arul is here. Chalavara near Shoranur. And this time, we are all privileged to be in a wonderful tourist attraction, city of Mysuru, to host the 3rd conference. See, it so happened, there were all kinds of horrible news, in 2024 I was receiving. Lot of changes taking place in the government, lot of changes taking place in Medical Commission, Pharmacy Council of India. One day we read in newspaper that a drug inspector, a drugs control officer is put behind bars. I get a message that one senior professor of Haryana commits suicide. Another professor who was a dean is behind bars for provoking. What's this happening? I received a call again from my favorite student. Sir, we are hosting conference in Mysuru. I want the theme of the conference. And I started thinking. I said, give me 48 hours. Normally, we hold conferences with focus on emerging trends, technologies, advances. I said, no. This time, our conference will focus on with all these news behind in my mind. Translation of value education and innovations in health sciences for societal transformation. With this theme, we conducted this conference, and I am happy each of the speakers tried to do justice to this very topic and address these issues. What has happened, at the moment, we see all kinds of criminal activities going on. It's not only robberies or thefts, we have cyber crimes, we have rapes. We all are aware of the incident in a medical college in Kolkata, a young doctor. Next day it comes in papers that she commits suicide, which was a murder. Where is the society going? Then I started preparing my talk. I said I'll give remedial measures, and I was before you yesterday, and this is how this body, Association of Pharmaceutical Scientists and Educators, took birth, and we have reached this stage. Then we instituted different awards. The teachers, the scientists, the eminent personalities in the country, whatever they are doing, we'd like to felicitate them. I am overwhelmed, you know. I never expected that. I have no words. Kind of hospitality, kind of love. It is great. It's great. But I'm happy on one thing. I'm glad, Hanmanta Sir Joshi, that you have such a great, generous patron. President Subraya, he says, you ask for an advanced center and I'll give you. What more a dedicated scientist wants? I am here to give, see, funding is not the only thing. It is one part. Technical guidance is important. I am here, I'll suggest an emerging area, say neurodegenerative disorders, and we can have in Mysuru for elderly care a neurodegenerative order center. And if that materializes, it will be my dream coming true. So please go ahead. We have conducted this conference well. I am aware it doesn't happen overnight, you know. A mega event of this kind. The ball must have started rotating several weeks ago. Hats off to the volunteers. They go unnoticed. The students, B.Pharm students, M.Pharm students, they are in touch with me. The day I landed, the teachers, faculty members, so many of them, each of the faculty, you know, they have been taking utmost care of each of the resource persons who have reached here. We are all overwhelmed. Very well done. It's a grand success. Keep it up. You have set a new benchmark for our conference. So go ahead. I'll tell the students there is no shortcut to success. It's only hard work which pays. They say genius is only 1% inspiration, 99% perspiration. I saw yesterday, you know, in the auditorium on this very stage, the students, artists during the cultural program, the kind of talent they have. Great, hats off to you all. Well done all of you. Thank you.
Thank you for your kind words, sir. May I now request Dr. Marihal Subhash, sir, to kindly address the gathering.
Good evening to everybody. The degrees and dais, Dr. B.M. Subrai, President Sarada Vilas Education Institutions, and Sri R. Dinesh, Secretary, Sarada Vilas Institutions, and Dr. G. Shekhar, GC member Sarada Vilas Institutions, and other dignitaries, Nirmal Singh and Milind Parle, and my favorite student, Hanmatraj Joshi ji. So, just first of all, I am thankful to the Sarada Vilas management honoring me on this occasion. And now, whatever today deliberation happened in 2 days about AI everywhere. So, just on Tuesday, the Triple IT Director, Indian Institute of Information Technology. There are only 8 institutions in India. The youngest one is in Dharwad. So I happened to a discussion with the Director, Sri Mahadev Prasad. He is the person. We are discussing, you are telling IT application, this field, that field, this field. But now the biggest field is the pharmaceutical and healthcare field. So why not application of AI to be done to these, to pharmaceutical education, pharmaceutical research, pharmaceutical drug discovery, and healthcare, different thing. And now the government of India is encouraging interdisciplinary research. Why not bring all the things? We had a discussion. And suddenly, my surprise, Tuesday they invited, appointed as a advisor and consultant to the IIIT. Then this is the first occasion I am coming after that appointment. And already there is lot of innovative centers are there. Now Sarada also can take that center with collaboration with the IIIT Dharwad as innovation center. With that, lot of things what you deliver happen, you can start with your PG students, PG teachers, and other things other than regular curriculum. So along with that, I attended one workshop for the teachers and the final students how to become entrepreneurs and make a startup. Just now, our IIT senior Shekharji was telling the DeepSeek incident a young lady did. So why not our pharmacy people also do those things? It is not that do MPharm, PhD, then work there. So that's why simultaneously can be done. That's why the IIIT has made a program that is called Incubation Center Entrepreneurship Program. So just I'll read what is the summary of that one. So now these things we are going to carry on. So already the KLE Belgaum, we had the Innovation Center MOU with the IIIT, and now here all the dignitaries who are there. So who are interested in this, I'll coordinate and making a MOU with IIIT, and a lot of technological benefits and even a lot of funds can be brought to your college. It's a new avenue. That's why other day I was telling everybody used to build one medical college, then around they used to build other colleges. Why not make a pharmacy as a center around their biotechnology? Various fields are come up now. PharmD has come, so healthcare has come. So making a pharmacy college center, we can develop many things around that. Old 30, 40 years back, first medical college, then engineering college, that's it. So now pharmacy, then healthcare. So with the intention we did, and now just what is the IIIT mission is there. So just I'll read the things. So IIIT Dharwad Research Park has been established by Government of India, a cutting-edge platform for committed creating a vibrant ecosystem that drives innovation, because a lot of speakers talk about innovation, and foster the collaboration between academia, industry, and National Institute and academia. By integrating groundbreaking research, advanced skill development, and entrepreneurial support, we are shaping the future technology and economy. So under this program, to provide dynamic platform that bridges academic research and industry needs, we aim enable to transformative solutions through advanced R&D, skill development, entrepreneurial ventures addressed to the world challenges. So with this, we are pharmacy people, we can also become entrepreneurs. With this, I am welcoming the management of Sarada Vilas and other people here. So who are interested to start a university center in their college. Not that university said. Today morning I was in JSS Mysuru with Professor Suresh. We are classmates and friends. So I told him also, he can start. So we can make integrated things. Whatever institutions are there, we can start research. Teachers other than teaching, so they do innovative things, research, anything comes out, and they can patent. The other things are telling now, the speakers told patent how to take to industry level. So there are people takers are there. Our job is to take you to do research, then take your research to industrial level, then you earn the things. So with these few words, again, once again, I thank the management and all the people for honoring me and giving the opportunity to express my views. So with this, I myself and my company, Suspend the Life Sciences, anything you want, collaborate, do the things. The Pharmaceutical Global is the first, this one, the data is brought in India by our company, and now it is managed by Sachin Marihal. So with all the things, how to become education into entrepreneurship, into business, into other things. So olden days are gone, now the next 10 years is the AI and advancement. Now we are the global leaders, and lot of support is coming from the government of India for startup. Last September, government of India revised the startup policies. So a lot of foreign people are ready to collaborate with the colleges, collaborate with the individuals. These things, these were not there in olden days. So this, with this few, my views, I thank once again.
Thank you for your words of wisdom, sir. May I now request few of the delegates to provide us with the feedback regarding the conference. I request few of the delegates to kindly provide us with the feedback on the conference.
Guru Brahma, Guru Vishnu, Guru Devo, Maheshwara, Guru Saksha, Parabrahma, Tasmai Shri, Guruve Namaha. Good afternoon to all. I would like to thank all the organizations and organizers, Sarada Vilas College of Pharmacy, and I also would like to thank special thanks to our beloved principal H. Joshi sir, Sarada Vilas College of Pharmacy, and I also would like to thank all the dignitaries and experts, and I also would like to thank our guide Dr. S.M. Birada sir and Dr. Mallikarjun Shetty sir. And this event enriches both professional and personal growth, and they allow participate to encourage with new experts. So ನನಗೆ ಇದು ರಿಸರ್ಚ್ ಆ್ಯಂಡ್ ಡೆವಲಪ್ಮೆಂಟಲ್ಲಿ ತುಂಬ ಹೆಲ್ಪ್ ಆಯಿತು. ಆ್ಯಂಡ್ ದಿಸ್ ಇವೆಂಟ್ ನಿಜವಾಗ್ಲೂ ಎಲ್ಲರಿಗೂ ನಾನು ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ತೀನಿ. ಯಾಕಂದರೆ ನ್ಯೂ ಐಡಿಯಾಸ್ ಆಯಿತು, ನ್ಯೂ ರಿಸರ್ಚ್ ಆ್ಯಂಡ್ ಡೆವಲಪ್ಮೆಂಟ್ಗೆ AI ಟೂಲ್ ಆಯಿತು, ಪ್ರತಿಯೊಂದು ಇಂಪಾರ್ಟೆಂಟ್ ನ್ಯೂ ವರ್ಡ್ಸ್, ನ್ಯೂ scientific researchers. So really helped me a lot, and thank you very much for wonderful, and this conference helps me a lot. Thank you everyone. Thank you one and all.
Thank you for your wonderful feedback.
Good evening, everyone. Respected guests on the stage and off the stage. Myself, Monisha. I'm from JSS College of Pharmacy, and I'm studying 5th PharmD. The overall conference was very useful and informative. I thank Sarada Vilas of College of Pharmacy and APSE for this wonderful conference. Especially, I like the session like antimicrobial stewardship program and the AI in pharmacy. That was very informative and insightful. Thank you so much, and I want this conference to be held again next year. Thank you. Thank you.
Thank you very much.
Good afternoon, everyone. This is Mohammad Arsalan from 4th PharmD Sarada Vilas College of Pharmacy. I'm very excited to give a review about the conference which was held in our college these 2 days. Our review is a very small word to speak about the conference because we don't have that much words to express which has been happened from these 2 days. Especially, I found very much fascinating words from Dr. Milind Pale sir, which he actually created a mindset in the students with his words. Those words were very auspicious for us. Thank you so much, sir. And I understood many more things which we can learn from AI by using it, by utilizing it in our life in a proper way. I found many more things with this conference. And one more thing, the hospitality, the everything which they have organized here was wonderful. I really appreciate for the things which they have organized here. Being a part of this, I'm thankful, and I'm thankful for our beloved principal, Dr. Joshi sir, for encouraging all the students to be the part of this conference. Thank you so much.
Thank you, Arslan. My request our respected speakers to provide us with their feedback.
Good evening, my dear President Sir of Sarada College of Pharmacy, all the dignitaries and the resource person of today's international conference. See, I do not know our Hanumantata Joshi. I just came about the APSE. I added myself as a member. As our President told Milind Palesov, during that association we had many programs of intellectual discussions of so many diseases. So this has grown such in state because this is organization where we wanted to invoke a new minds, young students to go ahead. I have for the last 71 years, 1971, for last 50 years, I have been a journey to give knowledge, share knowledge to the young students. I have done it in many countries, I am doing it. This Sarada Vilas College of Pharmacy, after hearing the speech of the President, our Subaraya Saab, lot of values, excellent values, core values of developing a excellent research person. I appreciate your vision, idea, sir. This Sarada Vilas College of Pharmacy has got lot of secretaries, board of members. Another our Segar sir, engineer, he has also given excellent message that something he can do. Everything is possible. Anything is our students. You are our future. We are here to help you, guide you, motivate you. I am here along with our Harmantata Joshi and our Sir Milind sir to cooperate with you, to guide you. Thank you very much, sir.
Thank you, sir. I once again thank all the delegates who gave us their meaningful feedbacks. My now request Shri R. Dinesh sir, Honorary Secretary, Sarada Vilas Educational Institute, to address the gathering.
Good evening, all dignitaries on the dais and faculty members, academicians and experts and dear students. Today we are in the final stage of this conference. I wish all the best for your future, your academic or your research, whatever it may be, where you are going to serve. One thing I want to say, I also attended 3 to 4 talks here because I could not present all the day here. Then I came to know that both traditional and allopathy or modern medicines combined conference was here. And also artificial intelligence, so many talks actually heard. Dr. Milind, Dr. Subrana Rai, almost Mahibub from Malaysia. Everybody has given very good eye-opening speeches, and also with the PPT, beautiful PPTs. Really, one thing I want to say, my own experience.
India is really rich in medical field. Not only in beginning, thousands years back or 2,300, 100 years, 300 years back, Ayurveda has got a major role. Then afterwards, this allopathy medicine or modern medicines, English medicines came, it has taken over by Ayurveda medicine. But in now homeopathy, every medicine is available for their body, it suits which medicine is actually suitable for them. But because of this, this is all developed by research only. Some of the medicines I might have not proven scientifically or clinical trials, but all, I hope all English medicines, modern medicines, whatever there, all are clinically proved and scientifically proved. What I say. Am I correct, sir? But definitely proven, because myself is the best example. From the childhood, what I suffered from liver function abnormal, next diphtheria, next typhoid, early days, it's very difficult. So all are life-threatening problems only. For that, at that time, we had this modern, whatever English allopathy medicine that actually saved me. Even in Corona also, actually, Corona given report as we given Corona, diagnosed as Corona in the report. But really, I didn't have any Corona symptoms in my body. And I was quarantined actually. Both my wife and myself, both of them have actually got Corona report. But because of non-availability of medicines, no prescription, no medicine that time, totally all medical shops are open, but without subscription, nobody is giving medicines. But afterwards, actually, 8 days, 10 days I suffered, but not having any symptoms. Quarantined and food delivered by my family members. What they have prepared food, they are having actually Corona. They are not having any smell sensation. They are not having any breathing. Everything is actually they had problem. But I am actually okay. But immediately my doctor over online helped me and suggested go and directly admit to the hospital. Otherwise it is a risk for you because you are having a diabetic and BP. Then I gone there. My body actually adjusted to this allopathy medicine. Every year I used to get some infection, viral infection. For that I need some injection. That is my body demands actually. Once I admitted, I was given injection. Next day I was all right. This is the fact. Therefore, medicine is really required. In future also it is required. Some of my friend actually was telling, invest whatever you want to go, you want to invest money, either in the share market or wherever. Please put your money in the pharmaceuticals company or corporate hospitals. Because it appreciates like anything, still a lot of problems may come. Already we are reading in the newspapers, in Maharashtra already, GBS, that one problem already arisen. Already 3 to 4 members actually, patients have died. 120, 130 people actually infected from that problem. Autoimmune system problem, I think it is. Then regarding artificial intelligence, what I say, please depend upon your own intelligence. Artificial intelligence tool, we have to make proper use. Wherever you want, then that only you have to use it. Because what Shekhar has said, that DeepSeek, actually yesterday I tried
because after hearing this talk and everything, I tried in Google Play to open that app. It is opened, but it demanded all personal details of mine. Then I didn't try. Better to not to go for at the time being, because it's China product. But one thing actually I read in newspaper, it has been developed beautifully, but they have controlled all their data. China data, it is not available there. If you ask regarding Arunachal Pradesh, it doesn't give any details on that. If you ask for Kashmir, it gives details. That is their rules and regulations, they have controlled all the data. Therefore, my dear students and research, whatever they are in research field, please do hard work. What I said a million, sir. Depend upon your own intelligence, and definitely those who work hard and understand the subject is very important. Just reading or making for examination purpose, it doesn't serve any purpose. Examination will be over, no problem. But without understanding properly, you can't succeed in that particular subject. And lot of chances are there in India for innovations and research work. And whatever we have seen, even Sachin himself is an entrepreneur, and Mahbub is also an entrepreneur in Malaysia. Please do hard work and get good result, and wish you all the best. And also I thank Mr. Joshi, has made very good arrangement, and organizers also. In Sarada Vilas College, we are having very good team, especially Pharmacy College. Yesterday also I told it, with under the leadership of Joshi, as our president already said him, whatever help you want in the interest of the institution and getting good name for the institution and also benefit of all our students, please come over, whatever you want. Definitely our GC General Council definitely will support you. That is definitely that assurance we are going to give him. And once again, thanks for giving an opportunity to speak some words here. Thank you. Thank you all.
Thank you for your encouraging words, sir. May I now request Dr. Nirmal Singh, sir, Professor, Punjabi University, Patiala, to address the gathering.
So, respected person sitting on the dais, and dear students, I don't think I have much words to say now. Parle sir has already appreciated the volunteers, and I would like to add on it. You volunteers, students, teachers, non-teaching faculty have done wonderful job, and I appreciate the effort that you put in making this conference a big success. One thing I like to mention about Dr. Joshi, I don't know how many limbs and how many arms he has. He is a person doing multiple tasking at a time, and that too with full perfection. He's a teacher, he's an educator, he's a researcher, he's an administrator. I don't know how many responsibilities he's doing at a time, and that too with ultimate perfection. And conceiving an idea of organizing an international conference, I think within a very short span of time, only 3-4 months back, he made plan that this time international conference of APSE or Society Association will be at Sarada Vilas Institute. And I also appreciate the support and the help extended by the management of Sarada Vilas Institute. And it was a wonderful indeed. The conference is really wonderful. I really enjoyed. And I think my other friends who have come from far places, they've also enjoyed, and they'll carry a lot of happy memories. I'm definitely going to carry wonderful memories. And I'm thankful to Dr. Joshi, organizers, and all the faculty and management for inviting me and giving me a chance to participate in conference. I'll leave a message for the students. You will find so many hindrances which will discourage you to move forward. But one thing I learned from my professor, Dr. Milind Parle, he's sitting there. He often used to say, convert your stopping stone to stepping stones. So with this message, I extend my heartiest congratulations to Dr. Joshi and team for organizing such a wonderful conference. Thank you, Dr. Joshi. Thank you.
Thank you for your kind words, sir. May I now request Dr. H. Joshi, sir, to present the presidential address.
Good evening to one and all. Respected dignitaries on the dais, off the dais, and ladies and gentlemen, dear students. I understand your restlessness because you have been here for a long time. You were very active in listening to the talks, but when it comes to the stage program, somehow I can understand it because we were there earlier also. First of all, I request everyone to kindly give applause to our management for all the support and guidance, because all people have been thanking and they are really appreciating Sarada Vilas College of Pharmacy. But without their help and guidance, we would have not done much things. Thanks for that. And conference, you have met wonderful people. You have heard wonderful scientists and educators. And many people must be thinking, I know a conference we keep on doing every year and what exact benefit we get. Actually, Professor Shekhar was telling the same thing when he was sitting there. See, when we were students like you, we never had this opportunity. I don't know about the others also. We never had an opportunity, especially in the degree course. You are fortunate because, we are able to meet such people, and especially you can see the people on the stage, they are going to be the models, for life. For example, I have seen Dr. Milind Parle. We have been associated from more than 23 years now. They have groomed people in such a manner to have, a meaningful outcome every time. You can see Dr. Nirmal Singh also, the prospective Vice Chancellor of Punjab University, Patiala. He was the Dean and Chairperson of Department of Farm Sciences for Punjab University, Patiala. So especially for the young friends, because everyone will teach, all teachers will definitely teach because that's the job of the teachers. And all students will definitely learn because they have to learn because they have to earn a degree. But out of that, how do we orient ourselves for research? How do we orient ourselves for the society? That we can get only from interacting with such people. And Sarada Vilas College of Pharmacy is trying to do that since from some time. And all people appreciated Joshi and Sarada Vilas College of Pharmacy. But the major appreciation goes to our dear students. Sir, from past 1 month, there are something, many times, जब parle sab bolte hai, we keep on hearing, अच्छे लोगों के साथ अच्छा ही होता है. See, because, fortunately we have such a wonderful company, even the management and all the people, and we have been, together with such people. We have wonderful staff, we have wonderful students also. More than 120 volunteers have been working round the clock from past at least 15 days, right? We had challenges from Pharmacy Council of India, we had so many examinations and all, and we were in such a condition, we were little fearing after a very long time. But the work what you have done is really exemplary. And instead of I praise you, if I get some kind of positive points from these people, for example, the hospitality, talking to them, shaking hands with them, taking for lunch, talking to them, interacting with them, that itself will give you a wonderful encouragement. That's how we learned. Because I remember Parle sir ne, when I got registered for my PhD, we used to do the same thing what you have done. We used to receive Professor S.K. Kulkarni. Then he will keep on asking what exactly you are doing, what research you are doing, and they will change the dimension also. Because many times what will happen, guides will send a student in only one direction many times, definitely not Parle sir, but generally. But when you talk to such people, you will get motivated. And when you participate in such conferences, see, the life is only one for a human. And we have to achieve very well, right? And we have to earn the respect and we have to earn the good reputation also. So that is why, my dear students, a big heads off to you. And all that has been already been told by everyone. It's a presidential address. So, see, it's the commitment. This is the attitude what we have in Sarada Vilas College of Pharmacy. And it's the energy what we have. It is not only a conference. It can be any day. It can be annual day. It can be any program. We do with a very collective effort. And this is, has resulted in such a good conference. It is not the first conference we are organizing in Sarada Vilas College of Pharmacy. Many conferences we have done. Just 2 years ago, we had another international conference where we had 1,200 delegates across the country and as well as the world. And this time we have people from other countries, especially online, due to visa issues, and they could not participate, physically. And one wonderful, I am not giving vote of thanks, it's still remaining with organizing secretary, don't worry about it. But it's my responsibility to appreciate, because you are the people who have done it, especially the scientific committee. Jinesh is sitting here, Ravi is sitting here, and all the people here. And I know, I think I would have spoken to you a little roughly or maybe in a higher tone, because that was required at this time. You understand it, because we have been working in a team. See, getting the abstracts, correcting it, reviewing it, and especially working with Professor Rao, who corrects it every time, 5 times, 6 times, 7 times, and meeting on time, publishing it. It's a very big task, and I really compliment everyone, not only Jinesh and Rao, but all the people who are part of the Scientific Services Committee, Harshit and all. Because the proceedings, it is not easy, because this will become a replica what we have prepared. There may be some small mistakes which can be corrected in the the online copy, but it's an indication of the work what we have done at Sarada Vilas College of Pharmacy. And big thanks to the President of APSE, Parle sir, and all the people sitting here, Arul Kumar and Mansa Deepa, Dr. Maitreyi, Dr. Gnan Chandran, and many people who are here, Professor Marihal. Because APSE, has got one small motto. Sir, here the membership is not by just paying the fee. It's only an invitation. Every member has to earn, a membership, and, they will be only selected in the executive committee. It's a global organization. We have our say in almost 9 countries. And yesterday we had Mehboob. He is representing Malaysia. He is Vice President of Malaysia. So we have people from different countries. And the idea was to, bridge the gap. Because, at least the people very well, even to get, a referee for PhD, right, is very difficult many a times. And this association, is like a bridge, which can bridge, the researchers and as well as, all the people, educators. And it is doing well from past a few years. And congratulations to Nirmal. He was my senior. And we had a wonderful time. And I really appreciate. And this is what, a teacher says. Maybe Professor Parle and his students, Joshi or Nirmal, or my students, maybe Harshit and their students, now you are. It is a legacy what we have to build. And especially Mehboob, sir was appreciating, Secretary sir. He was unable to speak 2 sentences very earlier. He was my roommate also. He was doing his B.Pharm and his M.Pharm. Now you can see, he speaks wonderfully. He has got 30 to 32 patents. He has commercialized it. That's what the life is. So my dear students, please take some the things from here. Please plan your life, and definitely you can be here. It is not only the stage, but you will be in a position to improve people, and you can encourage people in future also. And I really appreciate the hospitality committee, because that's a very, very important one, because I have been getting all positive feedback. The moment the people landed in Mysuru, my apologies for all the resource persons here. Due to scarcity of fund, we could not give any the travel charges. And we know very well, I already told you, it's like a family. Nobody has come, they have come, to meet the families. It's like a family. And our, the godfather is Dr. Parle. So we always want to meet him. We have met in other occasions also. But from Mysuru to Mysuru, I think, our people have done a good job. Right? Even it can be 1 o'clock, 2 o'clock in the midnight. Absolutely, there was no complaint. Betta Swami, then Abhishek, and as well as Raghu, and all the people, right? They were at the guest house. And thanks to Dr. Sandhya for giving, an opportunity to, for us to make the people stay there. Because it would have been very difficult for us to book a hotel because of economy issues. Thanks to VTU for that. And I really appreciate, and especially volunteers. And our people said, our volunteers received them very well, took them to the guest house, got them water, right? And it was really good. And that's what, our hospitality is, mimics our behavior, isn't it? See, many times if we tell, our background, mimics our behavior. So that is what we are getting. Thanks for that. And good food, 2 days, there was no complaint. All people were very well. It was hygienic, right? And, the stage committee also. So you have done a wonderful work, and all effort goes to the volunteers. And those people who have been simply sitting and observing the volunteers, you can become volunteers in future, right? So with this, I really thank everyone on the stage here. We have taken a lot of time also. And thanks to Subraya sir, because he has already, assured us that we can start a new venture. So we'll definitely try to do that. And thanks to Professor Marihal also. We will see, the possibility of having an MOU, and we can have a center also here. We can plan that. And thanks to all the resource persons, we have come all, from different parts of the country and some people from other part of the world also. Mehboob traveled all the way from Malaysia with his own expenses to add that. So thanks to everyone, and you have made our day, and I am very sure you will carry a very good memories with you, and especially dear students, when you see after some time, maybe 10 years or maybe 15 years, you will cherish the memory, right? So with this, I wish you all the best and have a wonderful time. And I really compliment the people who have presented their papers, especially from Sarada Vilas College of Pharmacy. And those people who are little apprehensive and hesitating, please don't do that. It's a wonderful opportunity to present in our own place, and you can do it in other places also. With this, I thank all the members of the local organizing committee, and especially Venkatesh and as well as Nagendra. We always had a lot of heated arguments and talks. That is what, the work happens every time. So let us not carry out anything. And we have become successful, I can say that. We can see, the beautiful topics what we had, beautiful speakers we had. Look at the quality of the abstracts also. And yeah, so with this, I thank you everyone for making a very, very memorable event, and God bless you. Thank you.
Thank you for your constant support and words of encouragement, sir. May I now request Professor Venkatesh, sir, Organizing Secretary, SVCP APSECON 2025, to kindly present the vote of thanks.
Very good evening, everyone. Very good evening, respected dignitaries, esteemed guests, distinguished speakers, delegates, faculty members, and dear students. It is my privilege and honor to extend a heartfelt vote of thanks as we come to the conclusion of this enriching international conference on translation of value education and innovations in health sciences for societal transformation, organized by Sarada Vilas College of Pharmacy in association with Association of Pharmaceutical Scientists and Educators, APSE. First and foremost, I express our deepest gratitude to our chief guest, Dr. B.M. Subraya, President, Sarada Vilas Educational Institutions, Mysuru, for his unwavering guidance and leadership in fostering academic excellence. Thank you, sir. We are deeply grateful to our chief guest, Dr. Milind Parle, for gracing this occasion with their presence and sharing their invaluable insights. Your words of wisdom and encouragement have truly inspired us. Thank you, sir. A special thanks to our guest of honor, Sri R. Dinesh, Honorary Secretary, Sarada Vilas Educational Institutions, Mysuru, for your support and enlightening us. Thank you, sir. Our heartfelt gratitude to our guest of honor, Dr. G.L. Shekhar, GC member, Sarada Vilas Educational Institutions, Mysuru. Your presence had made this event all the more special. Thank you, sir. We are greatly grateful to our guest of honor, Dr. Nirmal Singh, Professor, Punjabi University, Patiala, for their presence and sharing their invaluable insights. Thank you, sir. Our heartfelt gratitude goes to guest of honor, Dr. Marihal Subhash, Advisor, Indian Institute of Information Technology, Dharwad, for your support and for enlightening us with your expertise. Your presence had made this event all the more special. Thank you, sir. I extend my sincere appreciation to our presiding chair, Dr. Hanumantachar Joshi, for his unwavering support and leadership in organizing this conference so successfully. Thank you, sir. Our heartfelt gratitude goes to all the distinguished speakers, panelists, and session chairs whose valuable contributions have enriched our knowledge and broadened our perspectives. Thank you all. A big thank you to our delegates, participants, and research scholars from across the world for your enthusiastic participation. engaging discussions, and thought-provoking questions. Thank you all. I would also like to acknowledge the Association of Pharmaceutical Scientists and Educators, APSE, for their collaboration and immense support in making this conference a grand success. Our special thanks to press and media personnel for covering this international conference. Our appreciation extends to the organizing committee, faculty members, volunteers, and technical staff for their dedication and tireless efforts in ensuring the seamless execution of this conference. Lastly, I extend a warm thank you to our Sarada Vilas educational institutions, Sarada Vilas College of Pharmacy Alumni Association, and Sarada Vilas College of Pharmacy Student Forum for support, and to each and every one of you who contributed to making this event successful. As we conclude this conference, let us carry forward the learnings, collaborations, and innovations discussed over these 2 days to make a meaningful impact on health sciences and health education for societal transformation. Thank you all once again, and we look forward to meeting you at future editions of this conference. Stay safe travels and best wishes to all. Thank you one and all.
Thank you, sir. May I request all the staff of SVCP to kindly gather on the stage for a group photo. I request the gathering to please be seated. I request all the gathering to please be seated. National anthem will be played later this session. Thank you, sir. I request the gathering to kindly rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you, everyone. With this, we have come to the end of the International Conference on Translation of Value Education and Innovations in Health Sciences for Societal Transformation. As we conclude this event, let us carry forward the knowledge gained, the friendships formed, and an inspiration ignited as we part ways. Let's not just remember this event, let's use it to inspire what comes next. Thank you one and all. Have a great day. The participation certificates will be distributed to all the participants of oral and e-poster presentation in the same hall where your presentations were respectively held. I repeat, the